We're good. Okay. I'm going to call to order the Yamhill County Board of Commissioners formal and informal session for December 8th, 2022. It is 10:02 in the morning. And Vice Chair Kula, would you please lead us in the flag salute?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And we have a notice that we will hold an executive session immediately following the combined session. Okay, I thought it was in the beginning, but maybe we're switching it at the end. Okay. The executive session is to consult with legal counsel regarding current litigation. We also want to note that there's been a change to our schedule. There will be no session on December 29th of 2022. Regular sessions will resume in January. Item C is our calendar session. We added a couple things for next week. There's an AOC Oregon Business Summit all day up in Portland. And then there's a hosted dinner at night. So in case we're there. And then we also have a wildfire workshop added for Tuesday, I believe. Okay, anything else to add to the calendar?
That's the
AOC.
that's the-
Yeah, the
oh,
virtual,
yes.
Right.
yeah.
No, that's it for me.
Oh, and this is both a correction to the current agenda, but then to also highlight that there's a work session topic that's on today's agenda, which is actually scheduled for next Thursday. So
Budget.
the budget discussion
Discretionary.
is, we talked about it last week. It's actually scheduled for next Thursday. So,
Okay. That's right.
so that's both a correction to this agenda, but then also for calendaring, correct. And then also just a reminder that next Thursday will be an earlier start time like we've done in years past. It's the annual years of service recognition for employees. And so that's not actually part of formal session, but we come over here at 9:30 and we'll open that and do the recognition, and then we'll go into formal session immediately following that.
Okay. Excuse me. Anything else to add? No?
No.
Okay. Item D is public comment. This time period is reserved for public comment on any topic other than an agenda item, a quasi judicial land use matter, or a topic scheduled for a public hearing. Do we have any public comment in the audience on anything that is not an agenda item, or in the virtual audience? If you could raise your hand, please. Okay, seeing none, we will move on to item E, which is our department update, and we are being joined by our Human Resources Director, Patricia Rojas. Welcome.
Tricia, good morning.
Good morning.
I think we have the tables back.
Make it work. It's okay. Just a good reminder that not to cross your legs. So good morning, everyone. How are you?
How are you?
Good, thank you. So the first thing that I wanted to start off with was just a good update for our team. As you all know, Megan, who used to sit next to Carolina, has now joined the HR team. She's with us in the audience today. And she's been a wonderful addition to our team. She knows a lot of the folks already here. So she was coming in with a little bit of knowledge, which was really great. And she's just done a wonderful job. So her main area of focus will be some support leaves to help with our recruitment process. Plus she's bringing just a really great, fresh idea mindset to our team. So it's been wonderful. We do have a little bit of transition, as some folks have already known. Dolores Johnson will be going to HHS. So that's a promotion for her, and we're very excited for her. So she's going to be taking on a full-time role. As you know, the HR support was a part-time role for us. And so she's going to challenge herself and go into a more full-time role within HHS. So very excited for her as well. And then we have not decided yet what we're going to do with her headcount. Right now, we're just going to focus on divvying up her responsibilities, but that's our team as of right now, moving into the new year. As far as projects that we have going on, we continue to refine our projects surrounding recruiting and retention, taking a look at what we already have in place and the options that we have and just how we're maximizing our recruiting efforts and systems that we already have. One of the big things that we've noticed is that we actually are getting quite a bit of clicks. So how do we turn those clicks into applications? So that's one of the biggest things that our team has been focusing on with the retention and the recruitment part. Training, we've done some really exciting training topics for our management. Ken had some really good ideas and we put those into fruition. So we now have on the calendar quarterly training topics led by Brown and Brown, CIS, and then we have that all the way out till March. And then our first one that we did in November was actually really successful. We got a lot of really great feedback on that. And it was all around recruiting and the interview process. So very timely for our managers. We also have the HR newsletter that has started going out. I believe every other month is the timeline. And then we have some really great ideas regarding digital toolboxes that we'll be presenting to Ken for refinement and any kind of feedback, and then looking to implement that. And again, using the resources that we already have to implement those. I'm going really fast. So any questions, comments? Oracle, we continue to work with Oracle. That's a big project. We do now finally have our structure complete for the HCM module. And that is basically creating the structure of all the positions and the reporting. So what you would see in an org chart. So that structure is complete. And now we're moving more towards the employee side of it. So this is going to be uploading and refining our employee data, making sure it's complete, that we have all of our dependent information, everything that's going into Oracle is clean and up to date so that it's good data going in from the start. So we're going to start that as well as our time management. So we've moved on to the next phase there. We also have our audits and compliance that we're taking a look at. We have a couple of audits coming up for HHS specifically, where we need to take a look at our paper files. So that's a new project that we're kind of taking a look at. And that is one of the areas that we're transitioning with Dee from when she transfers to HHS. And so that's going to be a big undertaking and doing some focus. And we've identified the need to do a couple of different internal audits, including an I-9 audit, which I believe has not been done recently. So we will be taking a look at that, making sure that our hard copy files are also in order. So that's scheduled for the first quarter of 2023. Any questions? Okay, excellent.
Well, before you move on, if
Yeah.
I could just add, especially on the Oracle project, the HCM, that is a major component of our software implementation. And I just also want to just emphasize that we accomplished a major milestone in July by implementing the financial part of it. The HCM and especially the HR it's a huge challenge and it's a big hill to climb, specifically while, for HR in looking at processes and data, because the current system that we have, while we use it to process payroll, there's a lot of HR functions that were never implemented in our current finance system. And this goes back 30 years, 20 plus, 25, 30 years ago when GEMS was implemented, which is our current system. There was a lot of HR processes that we didn't utilize in the current system. We're looking to make full use of the new Oracle system. And so there's a lot of things, and a lot of this work is falling on the HR team because we're having to look back at 30 years of process, data, PA forms, personnel files, a lot of things that weren't necessarily being handled in our current finance system. And so I know Patricia was very humble and presented that that's a major project. I just really
Yeah.
want to emphasize on how big of a effort this is. And we're looking at a go live date in the spring of 23 with that portion of it. And so it's a huge lift that the HR team, IT, payroll, finance, admin are all working on and working with the department heads. So there's going to be a lot more information and updates to come, but I just want to emphasize that you gave it 5 minutes, but it's this is a major workload task that's occurring on the HR team.
Yeah, and it's definitely, while, I know that we do coordinate a lot of that, it's been a huge effort with a lot of the other departments. So a lot of hours and hours and hours sitting with IT and, painstakingly going through, line by line. So yeah, I did kind of gloss over that kind of quickly because I know there's a lot to get done today and updates, but it was a very big milestone for us. And I did a little happy dance in my office, just FYI. So.
I think that. I was like, yeah, I know.
Yeah. In the 2 senses, yes. So anyway, thank you. So we've got some really exciting stuff coming up in 2023, more milestones for Oracle, definitely. We're going to be looking to conduct some stuff internally just to make sure we're maintaining that clean data. Another big milestone, I think, for us too, is our FAPO contract has been ratified. And so we're ready to move forward with the needful actions that we need to take on for that. Hopefully I'm not out of line by saying if there's a signature needed and you haven't signed that off yet, we are anxiously awaiting that, as are several employees, for us to post online. And then I know Teamsters has made the move to mediation. So that's a big contract update for us, because I know we have a lot of employees from the HR side. What we deal with too is, I know the negotiation team is pretty busy, and that's been going on. But then, just from the employee perspective, answering a lot of questions, what happens, are things going to be retro? So trying our best to keep our membership and our employees at ease with the time it's taking. We also have our remaining 3 contracts up for negotiation in 2023. So kind of preparing and working with county council and the rest of the administration team to get prepped and ready for that. Our last big upcoming thing that I wanted to just kind of give an update about is Paid Leave Oregon. That is scheduled to go into effect in January. We have issued a communication countywide to everyone that that is going to go into effective January 1st, and the employees can start to see contributions being deducted as of January. The program will not go into effect until September of 2023. So we'll be paying into those funds for 9 months until employees can start to see that benefit. There also is a plan for us to start putting little flyers in NODs, and we're anticipating that's going to go out on the 15th. And we'll have that. Lots of questions, lots of feelings, emotions, questions that are coming with that program. And we did take a look at a lot of the different options that were available to us in this. And ultimately we did go with the state plan. That is going to have the most minimal financial impact to the county, and is going to produce the most ease of maintenance. So we did take a look at several options, and they required quite a bit of change on the county's part, as well as quite a significant
Reporting.
investment.
Yeah.
So, yeah. So I think right now we're looking at 1%, and for the private quotes that we got, it was, close to 1.6, 1.7%, which is significant. So, and then we should have the physical posters that are required to go up by next week. So, any questions?
I appreciate the flyer. I think McKaylee sent it out. It answered some questions even I had about when it actually goes into effect and all of that kind of stuff. So, And I did just ask Ken to clarify that we are doing the 60-40 sort of basic intro split. That may change in the future, but that's what we've decided to do.
Correct. The county will be paying 40%, the employee will be paying 60% of the 1% that's going to be due.
And we're anticipating that, you know, I'm looking at my crystal ball that this will
Yeah.
probably be a topic with bargaining.
Yeah.
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 Yeah, and then the other part that I would just emphasize, I think this is going to present some further challenges as far as for the HR team and the management team in general. I mean, this is a new benefit that's coming in. I think one of the unique things, or at least some of the frustrations that I had when I first reviewing it, because other states that implemented a program like this, they would take OFLA off the books or have it run concurrent with the Oregon Family Medical Leave laws. But instead, this is in addition to. And so, you know, on top of our already what we bargain as far as the leave package, the OFLA and FEMLA leaves, short-term disability benefits, and now this new paid leave on top of all that, it just presents some further administrative challenges on how we manage those leaves and how they interact with one another. And so we do see generally, without getting into specifics and stuff, we do see a lot of leave utilization when it comes to family medical leaves and some of these other areas. And so then this is another layer of protected leaves that are also coming into play that are going to present some challenges into the future as far as an administrative and workload impact.
And it has changed several times in the year from when we first heard about it to now. So we anticipate that there's probably going to be some more changes as the program rolls out before September. So.
I want to make sure you're through your presentation.
I
have a
am
couple.
through my
Okay,
presentation,
okay.
yes.
So just a quick question on, you were talking about recruitments and how you track some of that. So for the folks that actually do apply, do you go back and say, hey, you know, how did you find out about us? What are our strengths in that versus? where we might be?
For the folks that do apply, I am not sure that is 100% happening. I know we try to do that. What we have seen is in the past, there's been some recruitments where maybe 1 or 2 folks applied and that was it out of 400 clicks onto the posting. And what we're seeing now is that there's a lot more. There's upwards of anywhere from 5 to 20 applicants per posting, which is excellent. But is there time to go back and survey all the applicants? I do not believe at this time that's been done, but we can see just from the technology perspective that there's clicking. We did a little bit of changing to the formatting and we noticed that the amount of clicks onto a position to review it, so they actually have to actively click on the position, that has increased quite a bit, about 100 clicks per posting. So.
And we do solicit information about how folks learn about openings, you know, just from looking at it from an advertising standpoint, where we're seeing the most traffic. But you're right, how intuitive the system could be to kind of track why someone looked at it and decided not to apply or something like that. How do we bridge that gap is probably a challenge and something we could look at.
And we're looking at that. There's some things that we, you know, say, hey, you didn't get the job, but could you fill out the survey? So finding a way to delicately put that through, we're still working on it. We're open to ideas. So.
And then one of my other questions, it's kind of an aside, but have we ever done an internship program with the county in the past?
Yeah,
Specific
we do it
departments?
at different departments. Usually it's at the department level.
Okay.
Because Public Works is a great example where they have the engineering interns.
Okay.
Another one, I know Community Corrections in the past has done practicums and interns, over there for future probation officers, HHS. So it's really been more at the department
Okay.
level.
Okay.
But it's not really it's not really a centralized internship type program. It's just if there's a department
Okay.
need or an opportunity, that's where those will come up.
Mhm.
Gotcha.
But your
Okay.
question does lead me to wonder whether that would be helpful as part of the online component of when somebody's looking for a position and then at one of their recruitments that there's a open internships.
Mhm.
Well, I was
just
just
thinking
thinking in
that it's
the,
evolved.
because there's paid internships and then there's, volunteer internships. So, and there's rules, more stringent rules, I suppose, around paid ones now.
Mhm.
So I was just wondering if that's something that historically we've funneled through HR or.
HR would be involved with it, but a lot of times, like I'm thinking of Public Works as an example, that's a partnership with George Fox.
Okay, right.
Community Corrections, they've had a longstanding partnership with Western Oregon.
Okay.
So there's some partnerships that are occurring, and Lindsay could probably share more about some of those partnerships and internships that she has as well. Those are two examples I'm thinking of directly where the departments are working directly with George Fox or
Mhm.
Western or Oregon State.
I just want to,
Commissioners?
oh, thank you. I just want to say, being in HR, this particular point in time is very challenging, and especially when there's the government component. So we appreciate you very much. You've been a real gift to this county. Thank you and your team. It's just more and more that's being asked of you. And so we appreciate that. The one question I had was regarding hiring bonuses and how you're seeing that impact your hiring.
So yeah, I think you're referencing, so right now HHS is the only one that has any kind of recruitment bonus on the books. And what we're seeing is pretty positive, I think. There's a lot of interest, a lot more interest, definitely. I'd be lying if I said that didn't spark a few more clicks onto the recruiting, definitely. From an application standpoint, there's been, and like I kind of opened with, a little bit of movement internally as well. So some interest, which is great. We're getting a department with folks that already have knowledge of the organization, which is great. It's not a bad thing, and new opportunities. So we're seeing some incentive for folks to maybe think about internally, hey, could I do that? Maybe I'm ready for something different. And it's been a good incentive for those folks. But overall, I know that getting those applicants, it's just the market that we're in right now. It's still one of those, whether it be a amalgamation of, education and the pandemic and, the recession concerns. So there's a lot going on in the market that is still at play. So has it improved a little bit? Absolutely. Is it, do I feel like there's a lot of folks taking advantage of it? Sure. Are there some internal folks that are taking advantage of it? Yes. And I think that's great. So.
And the other part is if the board has questions, and especially specifically around House Bill 4004 and the implementation of that. I know we've had some discussions, and that's probably a joint Patricia and Lindsay and the team. We could pull some stats and some data so we could give something a little more definitive, if the board would like an update on that or report back on how that's working, we can do that.
Okay, thank you. Great. Commissioner Gould?
No more questions, but thank you.
Thanks very much.
Also, just skimming over some very big. But I appreciate.
Yeah.
And I think the other important thing to highlight too is you just had your 1-year anniversary.
Yes.
So-
My 1 year.
So
So
Patricia's been with us for a year, but it seems like, she has been doing a fantastic
Yeah.
job. It feels like
you.
she's been here for 5 years
Yeah.
and she's just doing a great job. So I feel like we really scored when she joined the team. So she's doing a great job.
Yes, thank you.
Thank you.
And I'm very happy to be here too, by the way. I really enjoy working with this particular team. Casey, I've enjoyed working with you as well and the commissioners, and I'm not sure that I'll see everybody before the end of the year, so happy holidays and happy new year.
Thank you.
Merry Christmas. Thank you.
Okay, so our next item is our work session, which has been moved to next week or should have been for next week. So there's nothing there. Item G is our consent agenda. And I just wanted to note on the first one, that this is a significant change in the sheriff's department. We've had apprehension canines before, but it's been a while. And so this is something that Deputy Waker kind of introduced to the sheriff and went out and chased grants and private money. And so this particular canine the cost of it is being covered by this grant from Canines for Cops. And then the training and all of that is going to be rolled into Deputy Waker's job, but we're actually going to partner with the Washington County Sheriff's Department for the training. So the ongoing maintenance cost, insurance, all of that is really just absorbed into the budget, which was sort of my initial questions. But other than that, I will move that we approve the consent agenda. Is there further discussion?
No,
No. All those in favor signify by saying aye.
I,
Aye. All opposed, same sign. Thank you. Motion passes. Item H is old business. Item H1 is consideration of approval of amendment number 9 to agreement number 169533 between Yamhill County and the Oregon Health Authority, OHA, for the financing of public health services, Board Order 21-248, adding funding award in the amount of $68,644.63, retroactive to August 1st, 2022 through June 30th of 2023. And this was continued from last week, December 1st of 2022. And I see we are joined by our HHS Director, Lindsay Manfred. Welcome to come up. So last week, if I'm sort of recapping our conversation, we'd had questions about specifically what's in the contract in terms of our efforts to address vaccine confidence, I think is how it was phrased. And so having a overview of how we do that, maybe as on a county level would be good. And then there was also concerns about information that was or was not on the website. And so those are kind of the two things I'm remembering that needed to be addressed.
Chair, I think there might be public comment on this. I don't know.
Oh,
if
great.
Now is appropriate, or you wanted to do a.
Sure. So if there is public comment on this particular topic and you are in the audience, please let us know. Or if you're in the virtual audience, please raise your hand. Are you thinking of
I don't know. I can't
Keith?
read that. So
the only one that isn't staff is Keith Nassman?
He is here to
Soil
answer
and water.
questions about the soil
okay.
or the wildlife or fire.
Pretty wildfire. Okay.
Okay,
They're not
I
the
don't
same
think
thing.
there's else.
Okay.
So, okay. So we will have Director Manfred take it from here. Thank you.
Yeah, absolutely. Thank you. So I think the first question is just around how public health staff and myself work to promote vaccine confidence in terms of what that contract language says and then how it's implemented in Yamhill County. And I believe an email was shared by Commissioner Starrett with some of that information, but I can certainly reiterate what that means to me and how we implement that locally. Really, I think for us, vaccine confidence comes down to ensuring that people have the risk and benefits of the vaccine. And after that, it is really ultimately their decision, of course, to be the decider if the risks and benefits, which outweighs one or the other for themselves. And so we do that through a number of things. We provide information. Anytime someone gets a vaccine from us, they receive what's called a vaccine information statement or sheet. Every vaccine has its own unique sheet. The exception to that is with any of the, when the COVID vaccines, before they had gone through the final and full approval process and were still under emergency use authorization, instead of having a vaccine information sheet, they had something called the emergency use authorization form. So it was a lot of the same types of information, but just captured in a slightly different format. But in any case, that information is given to anyone who's receiving a vaccine. In the case of someone who is a child, that of course goes to the parents. Those documents can be found online. They are required by law to be provided every single time. So even if someone's coming in for their fourth DTaP, we're still required to give that to them, and we absolutely do. The information in there includes things like the benefits of the vaccine. It also includes risks. I believe in that email I attached an example of one of them. I'm pretty sure it was a polio vaccine information sheet. And clearly it really says all risks up including death, right? So we're giving information that says that is a possibility to families when they choose to vaccinate. Also included in that document is information and a link where they can go if they wanted to see the package inserts. Certainly I have had the case where a family member or parent has asked, back when I was doing vaccines in the clinic, asked to see that. We have those available, certainly. So we have provided those upon request to families. They are very small print and not easy to necessarily navigate through, but certainly it's available if people want to, or they can choose to use the link and go to I believe it's to the FDA's website where they can see that per each vaccine. So I think that those documents do provide a pretty clear risk and benefit information. And in addition to that, every person who comes in to get a vaccine fills out a form. We call it our vaccine administration record, or our VAR. And that includes questions that help us rule out anyone where a vaccine might be contraindicated, or anything where we just might want to be more cautious, or we might need more information. Or in some cases we say, we don't think this is the best place for you to get this. I think you need to go to your primary care provider. Is that an option? Is there anything we can help you do? Examples of that are, certain types of conditions that someone might have where we think, this is probably not the best setting. That's rare and doesn't come up very often, but I mention it just because it is something that all of our clinic staff are always watching for, and making sure that they are making those medically appropriate decisions. Other things that are included on there are things like certainly allergies and things of that nature, pregnancy, breastfeeding, things like that. I believe I've shared this with the board in the past, but I want to make sure that we've had lots of conversations, so I want to make sure I include this. Specific to like the COVID vaccine, before it was formally recognized and promoted from a recommendation standpoint from the CDC, which I believe happened in August of 2021. So after several months of the vaccine being out, we really, when someone would mark pregnancy, it would be a matter of, this wasn't studied during pregnancy. If you have questions about, we're still able to give it to you. If you have questions about that, it's a good thing to check in with your prenatal provider. For us at Public Health, it's also always an opportunity to make sure someone has a prenatal provider. And if they don't have, let them know that we can help them access one if they need to. Always thinking holistically and the whole person. But really those questions are there for a reason. They are prompts for our staff to make sure that they can dive in deeper to anything that someone may be at higher risk for, may have more questions for, or that we may have more questions that we need to dive into. If someone puts something down there and we say, well, let's really make sure that this is medically safe for you to do. And in like I said, in some cases we say, I think this would be better if you connected with your primary care provider about that. So that's sort of talking about, I think, again, back to creating confidence, I think, is through sharing information. I think the other thing that we really encourage people to do is to talk to someone that they trust, a healthcare provider that they trust. If they don't trust me as the public health administrator, if they don't trust, whoever they are, then go to somewhere that you do trust. Do you trust your primary care provider? Do you trust, whoever it is that you seek for advice around these things, and to go to them? We don't vet that. We don't say who's your trusted person and then try to dissuade them, right? We just, that is the message. go to a trusted healthcare provider. And we also do, when asked questions about things that are not accurate, we provide the accurate information. So examples including, are there tracking devices in the COVID vaccines or the pertussis vaccine, right? This has been something we've heard throughout the years. We will say no, right? I mean, I think it's important for us to be able to have the ability to debunk things like that when they do come up. So I think in that is essentially how we go about providing vaccine confidence. And that's really been our strategy throughout COVID. And that has been what we've done historically with vaccines in general.
Okay, thank you. So I heard you kind of touch on it a little bit, but during the COVID vaccine rollout and in the early stages of it, you said that if a pregnant woman would come in, you would advise that the vaccine had not been tested on pregnant women as part of
Yeah,
the education.
There was no formal recommendation at that point. It was still, again, still allowed, still authorized, and over time, as they saw, really, I think what occurred, and I, want to be mindful, I was not part of these decisions, obviously, in terms of making these wide recommendations. But over time, as they saw the impact on COVID-19 and specifically on pregnant women and the really poor outcomes, again, looking at the risk versus benefits, and that's how those decisions are made. And I don't know the timeline of the other organizations, but I do know that the American College of Obstetrics and Gynecology, often called ACOG, and the American Society for Maternal and Fetal Medicine, both are pretty widely recognized bodies of organizations that put standards of care practices in place, both have since then adopted the recommendation as well.
Okay, so I'm kind of sticking to the vaccine, addressing vaccine confidence part of this. So, and we've beat this drum several times before, but in terms of, promoting the vaccine, we're not offering anything in exchange. We're not, doing any sort of special marketing around it or whatever. We're just, our version, Yamhill County's version of Vax Confidence is to make sure that if someone voluntarily comes in, they're given this information.
Yes, we
Okay.
do push out information through our Facebook page that includes, usually their statements when I've seen them, looking for a COVID vaccine, and having links of where they can go to access it, things of that nature have been the things that we've pushed out on social media.
Okay. So Commissioner Sarah, you kind of had focused more on the information we were giving, the website, what's there, what's not there, if you want to maybe address that portion or.
Well, I think these are discussions we've had in the past, and I appreciate you working with us on this, and Ken as well. The things that were, for me, just a little bit concerning had to do with the fact that we were not, as is required for the EUA issued by the FDA, we were not putting a disclaimer clearly and conspicuously that said that these products have not been licensed as safe and effective. And I've said this before, but being on calls with OHA Director Pat Allen, when the vaccines first came out, he did say that they were FDA approved, and I was trying to correct him on that, and he was steadfast in saying they were. We're still in clinical trials, and people need to understand they're still in clinical trials at this point. The other thing, again, is that when we say in how we promote confidence is that we give theirs information and that type of thing is, as we've talked about before, theirs is a very convoluted CDC system. It does yield some wonderful information, but it's not something you can just like go to and see, summaries and things like that. It's just kind of wonky, and it's so complex that people don't even want to submit one because it's just so hard to do. So I guess what I've wanted all along is to be able to say that we are, as per your website, you say that we're committed to sharing local, accurate, and current information as we hear it. And that information keeps changing. And as you know, we just keep getting we know way more now than we did in the very beginning when everyone said, hey, you can't catch it and you can't spread it. But we know that's not true. And we know there are some significant side effects. And now they're even studying about myocarditis and things that we discussed a couple of years ago. So what I'm suggesting is that when we do try to get some kind of confidence back in our public health system, which I think is just universally, being, the integrity of it has been questioned, but not, not specifically to you. What I'm saying is when you have something up there that says these vaccines are safe and effective, and we're not really mitigating that or qualifying that any. And we now have information just by the VAERS data that shows that that is kind of a difficult statement to still make. So those are where I'm stuck.
So our website has gone through so many iterations, right? Because as you pointed out, things have changed, and at times, sometimes what we've had to do every few months, and this is happening less because things are changing less frequently than say they were at the earlier stages of the pandemic or even the earlier stages of the vaccine rollout. But still, we're still watching for it. Is as new things come out or new information is shared, whether that's around vaccine safety and effectiveness, or whether that's around eligibility, or this element has now moved out of clinical trials and has been, all of those things. One of the things we find is we add all those things to our website, and then it starts getting really hard to read because you just got layers upon layers. And so periodically, in addition to keeping things updated, we do kind of what I say a refresh. And sometimes that generally is triggered by me going to the website to look for something and feeling like there's so much happening. I think it's time for a refresh, and we've got a great team of folks that are like, okay, well, let's make sure that this is easy to find, right? We want to say, so the things that we're looking for in those cases are, let's make sure it's easy to find whatever someone's looking for. We're using language that people are going to use when they're, what am I thinking of when I'm trying to find this? And that it's not layers upon layers, and that we don't have duplication, because duplication, one is it makes it hard to, can be hard to find things, but also it's really hard to manage because anytime something changes, you have to change it in multiple places. So I say that because I am not sure what website iteration we may have all different website iterations in our mind. And so I'm wondering if it would be helpful to pull up the existing website to just, so, and I'm happy to do sort of a virtual browsing and hear any feedback that you have. I know one of the things that we did discuss, Commissioner Starrett, and I said that I was absolutely I was fine to add it, was links so that people could find the information about the clinical trials for both Pfizer and Moderna. I have since gone and found those links that you can find through through a public mechanism so that everyone has access to them. And so again, that's not up there, but I'm happy to add that. So if you want, I don't know if that would be helpful.
Well,
It might be.
and I would just highlight, because I have it ready, I can share screen if we want to do that. But if you want to talk about too, that there has been some work done on the website.
Absolutely. Right. Yeah, so we do a lot of different iterations. The most recent one, I think our goal was to decrease any duplication, remove anything that that was outdated, because sometimes, and we can tell by clicks, no one's going here. I don't think this is somewhere they're looking for. Yeah, so this is the homepage, the landing page, if you will, if you were to Google Yamhill County COVID vaccine. This is where you're at. What we did was there were previous to this, there were lists of different things that just now 6 months old are eligible, and these, right. And so it was eventually, you'd get down to these boxes where someone might be looking for something. And so what we did is just clean all that up, remove any of the verbiage at the top, and instead just get these boxes up there where they are the things that are categorized in the way that we felt made the most sense. So some of them are really clear, right? Upcoming vaccine safety and events. If you click on that, it does take you to a grid of different vaccine events, as well as the different paperwork and documentation that you might need. It lets folks know the types of vaccines we have available, because we do have, the 3 different vaccines. provides information about just what to bring to your appointment. And then, as you can see, the emergency use authorization fact sheets, which do, just as a side note, do and have always at the very beginning of the document itself, in the ones that haven't been FDA approved and are still in late phases of the clinical trials, which is largely in youth. The adult ones have, for the most part, been done. It states that they're under emergency use authorization. They haven't been FDA approved. So all of that content is in those EUAs. Just information around, if you're under 15, you do have to have a parent or guardian with you. And then our consent form, should people want to do that before they come in. And then these are just operating hours. This document probably was more important when people were scouring the internet, really trying to find vaccines when they are harder to find. I think now folks just walk in. And then probably the one that may be of most interest is the vaccine safety and effectiveness. This document really, or this, not document, this page, a lot of these updates were made several months ago, if I recall correctly, and largely what we've decided to do is just link to CDC webpage rather than narrate or commentate on our own sort of interpretation of any of those things. So this is the information around vaccine safety and effectiveness. Commissioner Sarah, this is where I thought adding those links to the clinical trials would probably be most appropriate in terms of just where it landed on the webpage, but absolutely open to if there are thoughts on having a better place for that. And then, like I said, those links just take you to sort of the CDC webpage.
Before we move on, thank you for this, Lindsay, and thank you, Ken, for working on this. The one thing that I would say that we could, I would imagine, agree on is that when we make the statement that they side effects are rare, I think what we're seeing based on VAERS, which has always been the go-to reporting safety signal a modality, that for us to make that statement again, that is what is of concern, so much so that NIH, FDA, CDC, they're all starting to do the studies on myocarditis and pericarditis, which showed up in the Pfizer data early on, even in clinical trials. So we're starting to see that, and we're starting to see it become more mainstream, if you will, and not just the sort of the tinfoil hat, contingent that says, hey, you might want to look into these. So I think we need to me, when we make a statement that they're rare, and then we've got a list here of risks of a vaccine reaction using the polio vaccine as the example, saying a sore spot with redness, sometimes people faint. So I think that there are more significant side effects as a result of the COVID vaccine, and we can't use the polio vaccine as the go-to. It's just pretty minor. So I think that, to me, it's always been about saying safe and effective, side effects are rare. And again, those are the parts that I want. And then again, conspicuously saying that they have not been licensed as safe and effective.
So many of them have. I just want to make sure that we've got shared understanding.
FDA licensed, final, and which ones are those?
So the ones where if you click back to where the emergency use authorization forms are, which do go into details around both common and more rare side effects. But yeah, if you scroll down there, Ken, all the way down, the ones that have a name brand, so the Spikevax and the other one, those have completed clinical trials, and so they are FDA approved. Hence the.
I wonder whether it would be valuable to change it from the EUA here. I'm not trying to add to your work.
No, that's totally fine.
If we're going to be accurate.
Yeah, I don't think that they have changed the document is the problem. But I will double check on that, and perhaps we could change some of the language around how we frame that too, just to help with ease of understanding. Yeah.
I just want to add, you were saying that it says side effects are rare. It actually, the language that's up there is side effects after COVID COVID-19, I think it means vaccine, it actually says are common. But severe reactions are rare.
Yeah.
So that's what it says, but what you had said was.
Okay, well, you know what I'm talking about.
No, I just want to make sure that you are accurately reflecting.
I'm
what's on the
accurately
website.
reflecting it. Thank you.
didn't, though.
Okay, thank you for pointing that out.
Yeah.
Well, I think most would argue that myocarditis is not a common and non-severe reaction, and the rates of myocarditis are quite high considering.
Mhm.
So,
I can share that that is a statement directly from the CDC's webpage. I'm not saying that that provides any comfort to you, Commissioner Starrett, but I do want to note that that is a direct statement. Commissioner Cooley, you're correct. It should say side effects after COVID-19 vaccine are common, but severe reactions are rare. That is a direct statement from the CDC. I absolutely, there's continued work happening related to understanding some of those rare side effects. But at this point in time, based on the numbers of people who have been diagnosed with myocarditis, they are still considering that a rare event. And I think the other thing around the VAERS data is it's an incredibly useful tool, and it can be a cumbersome tool to have individuals directly input their information. And if anyone is experiencing an issue or challenge in being able to navigate that system to enter information about a vaccine event, we are happy to help support them and do that. And we are required to, if we learn of something that could be contributing to a vaccine, an adverse event related to a vaccine, we are required by law to do that, and we take that very seriously as well. The other thing about the COVID vaccine that is unique to the VAERS system, unique to other vaccines, is with other vaccines, the message and what the requirement is for healthcare providers is, if you believe that this adverse event is related to the vaccine, you are required to report it, right? And so as a medical professional, there needs to be a belief that the vaccine is the cause of what might be happening. The COVID vaccine is different, and the requirement is anything that happens to someone, even if you don't think it may be related, right? And that could definitely happen, even if you don't think it's related, even if you are certain that this is related to this person's something else that's happened to them, they're still required by law, as we as public health providers as well, are still required to enter that information in. So that is a unique piece to COVID-19. And it also means that when we are or when they are really the people who are analyzing the VAERS data, it creates more complexity for them to do their due diligence to figure out what is related to the vaccine and what may not be related to the vaccine. And then of course, there's always the work that has to happen from the risk benefit ratio of, so COVID-19, for example, what's the likelihood of someone getting myocarditis, for example, from COVID illness versus vaccine, and what's higher, and those are things that come into play when bodies like the CDC are, or the, ACIP are making their recommendations around vaccination.
but weren't those increased levels of reporting because of the EUA? Wasn't that a requirement because it was an EUA?
The reporting, yes. In terms of just the changes in how we do that. That I would assume so, but I don't necessarily know, and I don't believe that requirement has been removed. To my knowledge.
I just want to point out, there was a government study that showed that a 2009 report of the electronic medical records showed that fewer than 1% of the vaccine adverse events are reported, and that was a government study. So the recommendation is, or at least the analysis has been that very few comparatively are being reported. So again, I think we can argue this really ad infinitum, and we're looking at basically a different view of this. I mean, most of the information we're getting now has not been released by the FDA, the CDC. It's been released through FOIA requests. that have been done by outside agencies. And as I said, the FDA tried to keep this stuff confidential for 75 years. So a lot of it's coming out now as a result of FOIA requests. And that's the information we're not seeing because we're going by the book. And I understand, how do you pick and choose what you go by? So I appreciate that you're going to be putting the Pfizer data up there so that people can see, for themselves. But again, I guess what it comes down to is our function and the promotion. And you've explained what that means and for us in our county. But what I'm looking for is to see, how do we, since we're going to be signing a contract or not, that says promotion, so that we have that definition of what promotion means, in writing. An email to me doesn't, what does it do? So I don't know how we bridge that little piece so that we can say what promotion means to us, so that we can define that term. And then also those things about safe and effective, because we know in terms it's got negative effect. It's negative. The negative effective statistics are showing that transmission and infection haven't really been good. I mean, they've even acknowledged this. So how do we do that piece?
I do want to just note, within the category vaccine safety and effectiveness, and in one of the links, it does take you to a CDC webpage that is pretty explicit around effectiveness. That, again, I don't want to bore people by going into the details, but it might be helpful. Ken, it's the last one. If you click here, should take you to this document. And if you scroll down just a little bit until you get to some links, of course, there's so much content, sometimes it can be hard to find. A little bit. So that first link there, COVID vaccine effectiveness, actually takes you to a table that breaks down the COVID vaccine effectiveness based on a number of things. It's categorized by age, it's categorized by vaccine, and it's categorized by the number of doses. You got to scroll down just a little bit further. And again, I am certainly, I can't speak for any other bodies. I can't speak for the CDC, but what I can say is there's no intention to hide information. Our goal is to, I think it's down there somewhere. Our goal is to make information available as transparently as possible, right? And there is a lot of variation in these statistics and these percentages based on a lot of different factors. And I think sometimes when we're talking about something that's really complex, it's hard to give a one-liner about it, right? And we end up with these big tables that are kind of messy, but that's the best that we can do, because we also want to provide all of the information and be transparent. And I hate to think that the complexity of it being interpreted as being non-transparent when it's just complex.
Thank you.
And Chair, or Commissioner Terry, I would note that after a lot of discussion, I don't think that at least I'm not seeing that on the vaccine safety and effectiveness page. It doesn't say anywhere on our websites that COVID vaccines are safe and effective, but when you go to CDC websites, it does say that. And then of course the asterisk, which is what is that?
Right.
And that's what the table is.
We're hoping to show.
Yeah.
So just a
Right, for the effectiveness.
That was the table for
Yeah, that was the
effectiveness.
table.
Yeah.
right. A question though. So did we at one point on our website say COVID vaccines are safe
I
and
think there were
effective?
iterations where it did.
Yes.
Yes.
So yeah, that was the one thing that I
Yeah.
appreciate you addressing.
Yeah. And again, I mean, as your local public health administrator, I do feel obliged to say that from my perspective as your public health administrator, I do think that the benefits of the COVID vaccine outweigh the risks. And again, we are trying to be as diplomatic and just getting information out to people. But I also have that role, and I just couldn't live with myself if I didn't say it.
So can you tell me what we've changed? Because it's kind of hard to go back and see what was there. I do remember it saying safe and effective.
I
but
can do
that's
my
gone
best.
now. Or just
Yeah.
from memory, what changed?
So there, on the page where it has the blue boxes, there was sort of running information, like just listed in sort of centered bold that had, information like, we now carry the bivalent doses. We now, the vaccines now can be given to 6 months and older. Like there was just a list of lots of updates like that were coming down, and it was getting messy looking, and also taking a while for people to even be able to like scroll down to get to the boxes. And we felt like all of the content in those running lists of things, like the examples I just shared, was content that was better served in the boxes. And so that was all removed. And that's what you see now. And then historically, we did have a frequently asked questions page that was on here. We decided to remove that for a couple of reasons. One, there was a lot of duplication between what we would have in a frequently asked question and what say might be in here around where can I find a COVID vaccine. So the duplication, but also it was just, as things have changed, things are less relevant or less needed, or quite honestly don't make sense anymore. And so rather than trying to upkeep an FAQ that didn't feel as necessary now, because things are not changing as rapidly and we are not getting bombarded, to be quite honest, with thousands of emails and calls every day, we felt like that was not necessary to maintain anymore. And so that's gone. There was information about the vaccine pharmacy program that was also on there to help people find access of to the vaccine through local pharmacies, because initially only certain pharmacies were getting doses, and they would get 100 doses a week, and we were trying to help them navigate how to best find those. And so that was on there, and that's been removed. It was a while back, several months ago, that we changed a lot of the content on the vaccine safety and effectiveness webpage, and really moved from having less like this is the statement from the CDC or the OHA, and instead just linking to whatever document. So, for information about myocarditis here, that sort of stuff. So that happened I want to say maybe in the summertime. But that was a pretty significant change to the website at the point in time that we did do that. And that was largely for ease of maintaining up-to-date information for our team to be able to link to something rather than find the information and then reiterate it in a different way. And those are the changes that I recall us all making.
Thank you for walking us through the web pages too.
Yeah.
Yeah,
that's
because
helpful.
you're right, that it has been a while since I've looked
Lots
at
of
it,
iterations.
except to look what's the phone number to call for an appointment.
Yeah.
So one thing that has surprised me, my son was in the doctor recently, and we were sitting there waiting, and I overheard the receptionist get a phone call requesting a vaccine, COVID vaccine for a child. And the response was, we're not doing that anymore. And when he went in to see the doctor, at the end, she asked him if he wanted a flu vaccine. And he answered. And then I said, well, aren't you asking about COVID anymore? And the answer was, no, we're not. So are you seeing this more and more, that doctors are steering away from giving this to children? And if that's the case, when does it come into play with our role in public health?
So I'm not seeing or hearing that locally through our community providers. So there have been clinics that are no longer doing, walk-in COVID vaccine clinics and things like that I'm aware of, where before they were, so I know that that's happening, but I have not been made aware of any clinics that are electing not to vaccinate for COVID unless there's some logistical barrier for them, because it is it's not an easy vaccine to maintain because of some of the freezing requirements and things like that. And so there have been some places that have elected, if they particularly ones that don't do a high volume, have preferred to refer their patients elsewhere. But I think that the majority of our clinics, particularly our larger ones, are still actively vaccinating for COVID.
Okay.
I think, Ken, did you want to say?
Oh, sorry.
No, I think the because then again, there was the same question that had come up before on how we're defining locally what promotion means.
Yeah.
And I think what Director Manfred has encapsulated here with the presentation is our interpretation is we're going to advertise that we have the ability for those who want it, where they can get it with our public health, and we provide all of this information that's readily available in this information. We go over it. It again, like I said, going back a year and a half, we're not using funds for events or incentivizing or doing anything with vaccines. What we're doing is those that want it, we have it available, and here's all the information that we have posted on our website. And then there's the additional information that is also shared in the clinic for those that show up there to get their vaccination.
So just to thank you for that, Ken. So the email that you sent when I said, hey, what does promotion look like in our county? And you listed pretty much that, just encourage people to talk to their doctors or, and then you list serious reactions, VAERS, vaccine injury program, and a link to the package insert. Can we in some way, or I would like to see us be able to make this something that is, we have this somewhere, in other words, not just in an email to me, so that when we say, okay, OHA, or we don't even necessarily have to, because there doesn't seem to have been a problem in the past with how we're addressing this. So that we can say, and I think what it comes down to, at least for me, is I feel like ethically and morally, I would not want to sign my name to something that says I was promoting something that I think we know now. I believe we see the data is clear that it's not a good thing. And I think we know public health in the past in this country has not been kind to people. We see what we did to the sharecroppers, Tuskegee Airmen, that the CDC director now just called a sacrifice. No, we deliberately allowed these men to die from syphilis and pass it on to their children. We did this. And in Oregon, we forcibly sterilized, men, women, inmates, foster children, quote unquote, homosexuals, insane people, diabetic. I mean, this is something that was done till the 80s. So I don't think that we can say public health is it's sacrosanct from things that are ethically and morally reprehensible. So I don't want to look back and say, oh, gee, I was part of this too, because other people knew what was going on in the past and they let it go on. So again, that's my bottom line, is the safe and effective. And thank you for acknowledging that and at least putting it on the CDC. If they want to say it, great, but we're not going to blast it up there as a safe and effective. Here you go. So that I appreciate. And I appreciate you listing the Pfizer data, because that's going to tell an entirely different story than the CDC has been telling us. So, and then also that when we, look to signing this, that we have our definition of promotion. There's no question about what promotion in Yamhill County means as opposed to promotion in Multnomah County, because we know they're entirely different things.
So, I mean, I think the mechanism, right, is better, probably something for Ken to speak to. I think where I am cautious and where I want to ensure we protect is my clinical providers, my staff, from somehow being out of line with a policy because they're recommending a vaccine to someone. And that happens. If someone has questions and they say, I have this immune compromising condition, is it safe for me to get this vaccine? What are the, and we walk through the risks with them, we walk through the benefits, and oftentimes they're looking to their healthcare provider to help them make that decision. And in some cases, we are their healthcare provider, and I do not want to have anything in place that is either going to feel like our providers and clinicians, myself, our health officer, are somehow being sort of, strong-armed against being able to provide their clinical recommendations. I want to make sure that we guard against something that would make it either feel like that's happening to them, or that they're going to be in violation of something if they do that. So I I want to ensure that we don't do something like that. Or that we don't do something again, where me as the public health administrator or our health officer is feeling like we're not able to provide our expert opinion on something when that happens, right? I don't have a specific example in mind. These are not things that have come up that have been contrary to how we've worked together. But I do have concern about putting something in place that would function in that way and be prohibiting like that and cause that concern, particularly for our healthcare providers.
Well, I think, and I'm going to share this with Ken. Ken, that's the email, and I think that I just read from and you had sent to me. It's
Sure.
pretty, it's pretty vanilla, and it doesn't handcuff anybody. Again, if someone goes, even if they go to usually most allopathic Western medicine, doctors are supporting and recommending this. It is the alternative and the complementary medical doctors who are saying, you know, let's take a look, wait and see. So I think what the email you sent me when I said, what does promotion look like? I think it gives you cover. I mean, if someone goes to Dr. Koenig or someone goes to one of your public health nurses and says, hey, what do you think? Well, I think we know that, you know, again, the narrative in general, you know, medicine these days is, yeah, this is okay. But we know that there are some chinks in the armor and it's becoming more apparent. That's not my function. If people want to go to a doctor who tells them do it, great. We do have cover there. I just don't want to be advertising it as safe and effective and not giving them the full story with the Pfizer data. And you've done that. And that, while it's not what I would love, it's a lot. It's a big concession. And I acknowledge that because I think that this has not been an easy discussion for us over the last 2 years. And it's not been easy for any of us. But that's as far as I think we can go based on what public health in this country is today. And I know you guys have been working really hard. So acknowledging that.
Okay. So, at least for my part, last week, I was looking for, specific to this contract, I was looking for something that defined vaccine confidence for us as a company. I feel like I've been satisfied in receiving that information based on what our discussion is today. And certainly Commissioner Sterrett's concerns, at least from what I see on the website, that's very different from what I remember looking at just a few months ago. So it seems like those changes have occurred. May not be perfect, but they have occurred. Commissioner Kula, any further questions or concerns from you
No,
based on
Chair.
past discussions? Okay. Okay, well, I guess I will call the question or move to approve item H1 under old business. Is there further discussion?
I just want to go on the record as I appreciate the work. I am doing this with great reluctance, but I know that this is probably the best that we can do. I appreciate it. This is difficult for me to do this, but I'm going to sign it.
Thank you,
And I just want
Commissioner.
to say thank you, Chair, or thank you, Director.
Director,
Thank you,
thank you.
Chair, for giving me an opportunity. Thank you, Director. I really appreciate
And
you coming
thanks,
here.
Ann. This
And I'm
is-
sorry that
it's
you
been
didn't,
a time commitment.
the time
Yeah.
didn't work out last week.
It's okay. I got to learn lots of exciting things about other things.
You know, I've talked to a lot of people from last week who said the same thing about the different things that they sat for. So
They're like,
With
we
that,
will
Chair,
be
I'm-
back,
I'm
but
good.
Okay, all those in favor signify by saying aye.
Aye.
Aye, all opposed, same sign. Thank you, motion passes.
thank you, board.
We have some other healthcare related items. I don't know, Lindsay, if you were planning to stay for those or
Do you
no?
need me to? I'm available. I'm not sure which. Don't go too far.
Yeah, I was just
I'll move away
thinking
from the
I can
mic
move
and
them
we can
up.
talk.
Sounds good.
I've had conversations on some of these and
Okay.
gotten some information.
Okay.
If you need to go, I can share what you shared with me.
Okay,
If you're feeling okay with that, then
I
do
am.
you have a preference, Ken? I'm happy to sit and wait. Okay, I'll sit.
I saw that Ken was making the, why did you stick around face?
Um,
Yeah, you had that face, the face.
well, let me just see here. 1, 2, 3. It looks like they're coming up right after the wildfire workshop, so it should be pretty quick. Okay,
Can we move that? Could we just
move it
move
down.
these up so that Director Manfred can, if there are questions? Because it seems like we might have more of an informational discussion in that and
Yeah, and Keith Naismith from Soil Water is on, but I
Yeah.
believe he's at a conference right now, so we can just do the, hey, in a couple of minutes, we'd love to have you talk.
sure.
Okay.
Once it's ready.
Okay, so
It's dangerous to speak for other
moving
people,
on
though.
to item I, other business, I will move I1 down to what will be I4. And we'll go to I2, which is consideration of approval of grant agreement number 178213 between Yamhill County Public Health and the Oregon Health Authority, OHA, for reproductive health services in the amount of $37,500 retroactive to December 1st, 2022 through March 31st of 2024.
Well, Chair, I just wanted to share the conversations that I've had with Director Manfred. I wanted to know what is the definition of reproductive health services? And the one thing, because it says in the contract that we have to provide counseling on all options. And I wanted to know, what does that script look like? And I appreciate you sending me information showing that you are allowing women to get information and resources on abortion providers, adoption, and parenting, so that we are providing that information to them. And it's not up subject to the narrative of what particular nurse is on duty at the time. So that
Correct.
everybody's getting the whole story.
Absolutely.
Gotcha.
Okay, that
Okay.
was important.
And this is specific to the jail, correct?
It is, and it's also how we work to incorporate that requirement into our general reproductive health clinic at the public health department as well.
And we don't provide abortions. We provide information on where to go, but we do provide information on adoption agencies and parenting resources.
Absolutely, including prenatal practices and
Mhm.
prenatal, other types of prenatal supports that people might want to access.
And thank you for keeping that current.
Yes, I will.
Great, okay. Do I have a motion to approve item I2?
So moved.
Commissioner Kula, any questions?
Nope.
Okay, all those in
Ready?
favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you, motion passes. We're gonna move to I3, consideration to authorize Lindsay Manfred to apply for funding on behalf of Yamhill County Health and Human Services to the Oregon Department of Human Services Vocational Rehabilitation to provide vocational rehabilitation services.
I would move approval.
Okay, Commissioner Stewart moves approval. And this is my only note on this was this is specific to mental health
Yes.
department. Okay. Okay, all those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes. And item I4, consideration to authorize Lindsay Manfred to apply for funding from the Oregon Health Authority for Behavioral Health House Bill 2949 Workforce Incentives. And my question on this particular piece, because it does affect behavioral health as well, was I just would like an update on House Bill 4004, because that was a significant amount of money. It was more than we thought it was going to be. And so have we worked through that to the point where we could justify taking another $500,000, or is there a difference between the two?
Well, maybe you want to start with the difference between the two.
Sure.
First, and then
Yeah.
we can talk about House Bill 4004.
Absolutely.
next.
So the difference with this funding stream, one is our intention is not to use them for recruiting or retention bonuses, but to do other things that we know support staff. And one of the areas of funding is to be used for supervision requirements. Mental health
So
clinicians,
great.
yeah. Mental health clinicians have really intensive supervision requirements and that require frequent touches with supervisors in group settings as well as individual. And that can be really taxing on an organization financially and structurally to be able to support that. And so we are excited to have the opportunity to have funding to help support that. That could look a couple of different ways, and probably, in all honesty, would be a combination, which would include contracted services for some of that clinical supervision. And again, this is not, what we would consider administrative supervision around their work, but really the clinical components. So some contracts, we have some in place, and we could certainly use more and expand. And then also supporting staff who have an interest and the ability, the sort of longevity and the licensure that allows them to provide clinical supervision. We have this in some areas and it works really nicely. And what we've done in the past is provide things like lead pay for them to continue to carry their own caseload, but also provide that clinical supervision for staff. It's nice for a couple of reasons. One, it's internal, and that's always nice. It's also a really nice way for people to dip their toes into some leadership roles. And we like to be able to sort of grow and build our teams within. So that's a whole body of the work that really is separate from anything that was within House Bill 4004. The other elements of the funding that we are really interested in is looking at investing in similar ways, excluding the bonuses with House Bill 4004. So things like the work tuition reimbursement, adding additional funding to be able to support that, as well as adding some of the funding to support, again, some of those very expensive trainings that we know not only help our clinicians gain even better skill set in some really evidence-based practices that are pretty profound and have great impact. But also, we know that staff enjoy those things and they feel really good when we're able to support them in growing and learning. And so I think it's both a benefit to the organization, but certainly is an incentive to them as well. I know Patricia and I actually have a meeting this afternoon to talk more about the tuition reimbursement program. Of course, we've not done this before, and there's a lot of nuance. And I was so happy to hear that Patricia does have some experience in this realm. You all said this earlier, but we are very lucky to have her with us. And so we are going to work on, okay, what does this look like and when can we roll it out? So I'm really excited about that. We know there's a lot of excitement for staff, and we know there's a lot of staff that are really interested in continuing to develop and move through various things and get, whether it's certification or education that's going to support their work with us. So it's an exciting thing, and really these funds will just continue to augment and build that sort of process.
Are we letting folks know at the hiring process or at the recruitment process that this is an option, and to what degree it would be an option?
We haven't done much related to the tuition reimbursement yet, just because it's so new and we're not exactly sure what it's going to look like. I'm hopeful that over the course of the next several weeks, we'll have enough sort of nuts and bolts in place to be able to have those conversations, because I think it's a huge draw. It would be. Right?
Yeah.
As someone with lots of student loans, I get it.
We haven't advertised because we haven't fully developed the program yet.
Okay.
And from memory, the majority of House Bill 4004 funds went towards bonuses and recruitment type bonuses. So less on training.
Yes.
Okay. How could this money impact your desire to have those 24/7 sort of mental health responders partnering with local law enforcement? Is there a nexus there for that?
I think certainly the funding could be used to provide any sort of additional training or supports around these that sort of work, and anything specific to that. We do know that there will be some training requirements for that as the state is rolling out some new requirements to us. Certainly our existing staff have all of the training that we've seen in any draft documents that the state's provided. But that doesn't mean that new people being recruited in will. And so we would be able to use it for that.
Okay. Okay, and then we sort of touched on the status of 4004. I don't know if you're ready for that, but
Yeah, and so for 4004, like Lindsay was sharing, we have a meeting this afternoon. Because there's other elements that were in that policy or that rollout of 4004 that we're still working on. And then the other time is, the questions that came up this morning about some of the data and the results, that we'll add that to our agenda for this afternoon too, to see what kind of data and what a report back to the board will look like. We are seeing, at least stepping back, I'm approving more hires
Yeah,
in
I've seen that.
HHS, but I will still highlight that we have 22 recruitments open right now.
Mhm.
For that's specifically to HHS, but that doesn't mean 22 positions. Some of those are multiple positions that we have vacancies, so I mean, I think we're seeing some positive impact, but at the same time, we still have a lot of openings and a lot of needs and hopefully, we'll continue to see some progress,
I hope so.
moving forward. So, and those considering a career in behavioral health, please take a look and consider it, because I mean, there is a lot of need out there, and us specifically, we have those needs as well. Because again, we're still open for business. We're still able to deliver services. We're still able to do that. But at the same time, a lot of our existing staff is shouldering this load. And when we're short staff, it has that snowball effect that if we're not onboarding sufficient staff, then we start getting into areas of burnout or difficulties. And then it's difficult to retain staff. So we do take this very seriously. We appreciate the approval from the board in rolling out the House Bill 4004. I know that was some challenges, and hopefully we'll continue to see some positive results, and we'll be ready to come back with some more specific data on what we're seeing based on the questions that we've had this morning. But in the meantime, if there are specific areas or data pulls that you would like to see if we could pull specifically, you can share those with me. You can share them with Lindsay, and we'll work with the team and see what we can get.
Absolutely.
Okay.
Well, I would move
And-
approval, Chair. of
Okay,
item-
Commissioner Starrett moves approval of
I4.
item, technically I4. Is there further discussion?
New chair.
Okay, all those in favor signify by saying aye.
Aye.
All opposed, same sign. Okay, motion passes. And thank you for joining and answering a bunch of questions, and appreciate it.
Thank you for waiting.
Okay, so do you think we're ready to go to Title III or?
Yeah, we see, I just sent Keith an email saying, hey, you're up next.
Okay.
So it looks like Carolina is going to allow him to speak or promote him to panelist, I guess.
Okay, so we
Sorry.
will, we'll open up discussion for consideration of approval to obligate funding for the Title III project, Yamhill Soil and Water Conservation District 2023 Wildfire Prevention Workshops, and this was moved to today from last week, December 1st.
And I think we're going to start with Ken kind of explaining why this
Okay.
is on here now as the process.
Great.
Yes, so where we're at right now is I did receive a request from Soil and Water. You may recall it was last year we approved a Title III request, and so I've received an additional request. It's subject because it is Title III funds. There are some rules that we have to follow as far as a public notice requirement for 45 days. And I think the intent for today is whether or not the board wants to proceed. And if there's a green light, I don't believe it requires any formal action today, but before I start the whole public notice and soliciting public comment and going through the process, and then after that 45 days, then the board would take an official action. I think at this point, it's just informative. And if the board has questions, and if you give staff the green light to proceed, I'll start the whole Title III process, but keeping in mind at the end of that 45 days, it would be coming back before the board for a final decision.
Right. Thank you.
Okay,
And we have with us Keith from Yamhill Soil Water Conservation District, who led the efforts and is leading the future efforts.
great.
So welcome, Keith. If commissioners have questions, you've seen the proposal hopefully, and then the cover letter as well.
Keith, I know if you can hear us okay. I would appreciate
can.
kind of an overview just from your perspective of what happened last year and how it went and who participated, et cetera.
Certainly. Can you hear me okay?
We can. Thank you.
Excellent. Yes, so the previous workshops were approved before my employment with the district, and it was handed over to me, and I endeavored to complete it as written and to the best of my abilities. We had 3 workshops, mid-March or mid-April, late April, and early May. I did outreach for them, which involved newspaper ads in McMinnville and Newburgh. There was social media outreach and outreach through the district's newsletter. And we held those 3 events. They were in 3 different areas of the county to try and get a broad section of the populace. And let's see, we had 6 or 7 presenters. We had the fire districts or fire departments from each local region where we were at. We had OSU presenting on fire ecology. We had Yamhill County Emergency Management there to talk about emergency management services and how they do what they do. We had some private companies there talking about brush control and also equipment maintenance, like for chainsaws for managing woodlands and such. And so we put together those workshops, and they ran about 2 to 3 hours, closer to 2 hours each, in a variety of weather conditions. As you remember, last spring was pretty challenging as far as that goes. So we had the 3 events, and there wasn't as much participation as we would hoped for. I did set up an optional RSVP system on our website so that I could kind of gauge how much traction we were getting. From the outset, the May event had the most people signing up for it. And that's also where we had the greatest attendance. So at each of the 3 events, the presenters gave their presentations, and people that were there were very engaged. They asked great questions. The presenters all worked really well together, referencing each other's aspect of the issue. And they were all very excited to be there. And so the outcomes, as I sent a report to the board detailing all of our experiences and challenges and successes. And I feel that the new proposal for this next spring, we've changed it up quite a bit in response to that. So rather than having the events outdoors, we would have them indoors in a hybrid fashion so that people that couldn't physically be present could participate. And then we also wanted to have all 3 events last spring were on Saturdays. So we are switching that up. We want to have at least 1 weeknight workshop so that anybody who's busy on weekends can hopefully make it in the evening. And we want to add to the outreach that we had last year with additional outreach and different additional avenues. There's more communities that I'm aware of now that we can do outreach to and have much better coverage as far as that goes.
Thank you, Keith. So just a couple clarifying questions. So you paid the presenters, right? They're paid to come and present.
What we did, we ended up doing stipends for the private participants. The public ones were outreach is kind of part of their job. So we didn't give them a stipend. We did provide a lunch for each of the presenters for their time. Yeah.
Thank you. And then I don't remember reading in the packet how many participants were in each month, but can you clarify how many came in March, April, and May?
Let's see. To the best of my recollection, there was 5 or 6 at the first one in mid-April. There were 7 or 8 for the end of April, which was kind of amazing because it was a complete downpour. And then there was 20 plus at the last event in May.
Okay, great. Thank you. Commissioners, any questions on this? And I want to say it was 10,000, right? Was the allocation? Okay.
I just wanted to give you a few minutes if you had any questions.
Yeah, no, I've
For
talked
Keith.
about it. I looked at the proposal. It seems like a much more likely to draw during a really if we have another very cold and wet spring. But it does seem like what I actually talked with Keith about. I looked over the different funding sources that are available from the state right now, because in theory with Senate Bill 762, there's a tremendous amount of support for wildfire prevention, and none of the grant programs were, they'd either be eligible for them or that they were accessible right now, and through the federal, through the Forest Service. So it was like, okay, this is clearly a very specific form of funding stream for a very particular work.
So then the funding that's available for these types of programs was not would not have worked in this particular case?
Correct. Yeah.
Okay.
Yeah. Which I was actually surprised at. I thought that for sure there would be money available through state programs.
Thank you.
And
Yeah.
is that because we're working with private landowners?
It's because there's not a state program right now to fund wildfire prevention education workshops, which is weird, right?
Yeah.
And there's money that's going out the door for essentially the work of preparing home sites and neighborhoods, but it really comes down to there's not a pot of funds for that.
And I was just gonna,
Oh, yeah.
just a reminder on the Title III funds. I didn't really go into detail. I know you're all really familiar with the Title III funds, but there's really limitations on what we can use the Title III funds. One is programs like this, that's the FireWise programs, and the other one is search and rescue operations on federal lands, reimbursement for some of those costs.
Right.
And so there's really those two categories that's available for funding with these Title III funds.
Yeah.
We have about 93,000 that's budgeted. Fortunately, we haven't had the sheriff hasn't had to engage search and rescue on federal lands. But we do have those funds available, and this was the first time funding a grant program like this the last time. So there are funds available to support this. Just looking at it strictly from a budgetary standpoint.
Yeah.
I have a couple of questions, and thank you for joining us, Keith. I appreciate your waiting. A couple of questions. I was looking at last year, I had similar questions, and that has to do with the fact that there are training videos that have been done through OSU Extension Service.
Mhm.
And so my question when the proposal came was, typically people don't show up for stuff, attendance at things is difficult, especially if it's outside and there are weather issues. And now there's a recommendation to do it inside. So my concern is that we're going to be spending money. That's a lot of money for kind of a little bit of a return because of the low attendance. But I'm wondering if we would be able to fund, Extension Service is really struggling. Is this Title III money we could give to OSU Extension, who has worked on these types of programs? And this is not to disparage your program. I appreciate your interest in the fact that you've put this together. You're great presenters. But looking at what they've done and the quality of their videos, it seems like people, I would imagine, would be more apt to on demand, look at videos that really get into some of the details, and the video would have to be shot outside.
I don't think it's necessarily limitations on who provides the Firewise training. It's whether or not the curriculum or the program that's being developed meets the requirements under Title III. And which this is something that I do know that when this first came up before, I shared all the information with Soil and Water Conservation District, and the program that they put together was looking at those requirements under that Firewise. So whether it's, fill in the blank organization, if there's, I haven't gone into on if there may be limitations to the organization level, but I don't believe so, as long as the curriculum and the program being presented meets the program guidelines.
Well, it does seem along those lines, it does, to your point about that, OSU Fire Extension, at least last year, was doing a series of webinars and log on and watch. I don't know the attendance of them statewide, but that may be, and it could be in the form of a request to Soil Water is, can you record these in a manner that is high quality enough to make it available to OSU Fire Extension, since they're going to be involved as it is.
Yeah.
You know what I mean? That
that's
like, because OSU Fire Extension is going to have to create it and find money to create it. And we have them, essentially as part of this proposal to do the work and bring people in. And then as part of that, perhaps it can be created.
I'm talking about the videos that they have, they've got a few of those out, and I know that they were pushing them out a lot. So I'm wondering if there could be, because I know that they were looking for funding, and OSU Extension is, especially in our contributions, how that would work. But would there be an opportunity for collaboration? Because I am trying to look at, like, the receipts from last year and what it cost and what was expended, and I understand lessons learned and the weather and all that. But to me, just because this is money that's available to us, I want to make sure that we're going to be good stewards of who gets the money to do what we're asking them to do. And you've got great presenters and a great program, but I'm just thinking how we could leverage OSU into this.
Well, I don't think we could necessarily pay for funds for something that already has been produced and held, but is the question, it's a duplication of program, because I haven't compared the two programs side by side to see if it's a different target audience, is it the curriculum, is it aligned? I don't know a lot about that. So my first thought is if OSU Extension has videos available, I'm not, or did a program, I'm not sure how we could reimburse or pay for something that already happened.
Yeah, I see. What you mean.
No, I wasn't
yeah.
suggesting that, because those are already done. They're in the
Right,
can and
right.
they're out there. What I was thinking is whether or not there could be, you've got the videos, the work's been done. I don't think you can, those are well done, and they're, so why reinvent the wheel? But is there a component where you've got a local emergency manager, and you've got local fire districts, and you've got all of the presenters that you mentioned, where we can also piggyback on the work that's already been done, so that you're not looking at, okay, well, we have to necessarily record videos that can't be shot indoors. So I'm not looking for reimbursement for them, but I'm looking at perhaps if the money could be used on their end to promote this more widely than they were able to do because of budgetary concerns.
Yeah, I think I'd have to look at the Title III rules more specifically on the limitations, because and again, we get so few requests along these lines, which is why, I'm very familiar with Title III, but this is something that comes up with a request once every several years.
I think,
I think there's some specific requirements around the delivery or the curriculum and how that's imposed. So I would have to do some more research into what's allowable.
I think that, I mean, I know that the language, Ken, is, and that these ones may be used for promoting, presenting, and teaching Firewise principles.
So, but wasn't the point of this program to focus on Yamhill County private landowners?
Yeah.
That have these types of risks?
Yeah.
I guess-
Which is why I think it, I mean, the original organizers said we want to make sure that like the saw shop folks are involved, because it's one thing to have technical guidance from somebody from Oregon Department of Forestry, but it's another to be like, where do I go for the safety tools that I need?
Mhm. I guess, at first blush, my concern is that we're spending the same amount of money on each one of these workshops, right? Because you're inviting the same people and they have the same stipends. And we know that at least 2 of them were poorly attended, so probably not a big bang for our buck there. So, potentially look at maybe one that the majority of folks can go to. I also think we have a finite population that we're trying to reach. So I'm not sure how many times they're going to attend a workshop for something that affects their property. And additionally, we heard last year, or when this came up last time, that there was some concerns from these private landowners that they didn't want people coming onto their property, so to speak, not that they were physically there, but there was a concern over, I'm not sure how much I want to open the door to what's going on my property and how I need to change things. There was also feedback about, well, I do this kind of work with my insurance. I live in a rural area. I live, among a treed area. And so this is part of my insurance conversation as well. I've prepared my home accordingly. So I guess I'm concerned about, the value that we're getting for the investment. And I do think there's quite a bit of investment that's already been made in some of what Commissioner Starrett was talking about with these trainings and so on and so forth. Then maybe there's a more cost-effective way to do this.
Could we
So
look
that's my
into
feedback.
collaboration? Like, in other words, maybe just look at some of the potential for, not recreating the part that's been done, but also piggybacking and adding to that for the local component. And again, knowing that these things are typically not really well attended. I mean, just in general, getting the public to come to things, how we can sort of leverage what we already have OSU has done or someone else has done. And then, you've really put together a nice roster of presenters, pretty much covers it. But again, it's the funding something that really didn't have very good attendance. That's the piece that I never, that's a sticking point for me.
Well, so I don't know whether this is necessarily a question for Keith, as in, he has a proposal that was brought to us, and he may need to go to his supervisors to have it adjusted. And it also depends upon a lot of what OSU's wildfire extension program is able to do, obviously, too. We know that they're able to attend as a presenter at this. In terms of interest from the public, the kind of the genesis, the origin story of this particular wildfire prevention concept came out of that in I think it was either 2021 or 2020 at this point, because there's a wildfire risk explorer, not the map, not the fire map. I forget what it's called now, but
yes, we had a presentation.
the wildfire risk explorer exists, and it's existed forever. Folks who are in the West Hills, essentially west of McMinnville, are in a higher fire zone, and they have a single road coming out of Eagle Point Way, I think it is. And they had a large gathering with staff from Oregon Department of Forestry, from a couple of other organizations. I think some people from Yamhill Soil Water Conservation District as well. And so that was very well attended because it was specific to, oh, we all know that we have a problem and that we have a single road. How do we work as a community? The challenge with that what I saw and heard of making that same program available across the county is that there's these individual organizations, if they're to do it all over, needed to have some funding for it, rather than just a one-off for a community that was really very aware of the need.
That makes sense.
Yeah, so I don't know if it's a neither here nor there kind of thing, but there was a strong need and clear demonstrable need and urgency from that particular community.
Well, and after the fires, I think everybody
I think you're right.
was
Yeah.
looking for something.
Yeah.
I just want to make sure that, you know, as we talk about bang for your buck, that we're looking at how we can do that. I'm just wondering if we could just maybe explore the possibilities of OSU. Now, would we have to devote, so your ask is for this, for the $10,000. So if we were to sort of scale back what Soil and Water's part of the heavy lift in this would be, would you consider perhaps ask for a lesser amount, and then we backfill it with some OSU stuff, or else help fund OSU for some of their participation based on title?
I think the hard part or the struggle is Soil and Water's made a request for the funds and OSU Extension has not.
Yeah.
you
And we do
I
know
don't-
that they're
I don't have
available
that
to
request.
speak as a presenter.
You know, maybe, you know, if there's, if the board has reservations about what is being proposed right now, maybe Keith can go and engage with Soil and Water, engage with Extension Service, hearing some of the feedback or ideas, and then resubmit the proposal, and then the board could consider or deliberate on that at that time. I've just, you know, for today, because like I said, you know, no decisions were made, but I need to have something that I'm going to share with the local RAC and also share with just the Resource Advisory
Yeah.
Council at the BLM, because I have to share this proposal as well as part of the 45-day comment period, but it would also give folks something to comment on to see kind of a plan. So.
Right.
Well, I think considering the feedback so far, I would be interested, Keith, in maybe coming up with a scaled down version of the proposal where you have one event, maybe in May when it's nicer and we historically have seen better attendance. And then also potentially exploring, you know, what are our options through these funds? Do we have an option to fund something that's, or send money towards public education of something that's already been produced?
I think that, was that what you were?
No, I was.
Yeah, I didn't think so. Yeah.
I was thinking it wouldn't cost us anything to include the videos that were already done, but I'm wondering if some of that could go to OSU to be able to work further with Soil and Water and sort of grow you know, the economy of scale. We can get more done, videos are done, and now Soil and Water brings the piece, the local piece and the live piece, if you will.
Gotcha.
So like a
Okay.
hybrid type.
Okay.
Yeah, I do know that, not to get too far afield, I do know that the fire program was specifically funded by the legislature. So it's like a separate, you know, it just pops into their overall budget rather than the regional office budget, right, of OSU Extension, which we know. But I
Okay.
definitely I understand more now your proposal, which is really to make sure that OSU Extension can be involved and that they get some kind of compensation for that.
Right.
Okay. Keith, does that sound like something that you're willing to tackle?
Yes, I have a couple of comments. I think one of the challenges we have is that, you know, when threats are immediate, it gets people's attention. And fire season, you know, is June to November. And so like late fall is like when people are really, you know, looking to go. The problem with that in our outreach is that that the preparation needs to be done way before then. And so that was the rationale for having the events in the spring. But I can certainly look into a scaled down version with just a one event. I can also reach out to OSU. I have reached out to them just to see if they were on board for another round, and they said yes. And with the 3 event thing, they were excited to split it up and have 3 different OSU fire extension people come. So I think they're very excited about that, and it sounds like they're looking for more outreach themselves. So I can reach back to them and find out, maybe there's a way we can collaborate, to Commissioner Sterrett's point of multiplying the effect with the videos. If we have it indoors and it's hybrid, then we could record it. And maybe with their help, we could splice and dice that into something that makes sense in a video format. I'm not a video person, so I don't know how that would be and what the challenges would be, but I can certainly ask them.
Thank you.
Great, thank you.
And one other thing, one part of the grant was for us to create a wildfire portal on our website, which we did, and we have included the FireWise documents and also the OSU videos that were out as of last spring. So I have seen some of those, and I have put them on our website as additional areas for interaction with our community members.
Okay, thank you.
Thank you.
Thank you. And then just for Ken's sake, we want to hold off on any sort of notifications, right, till we see another updated proposal.
Yeah,
Okay.
I think at this point, because I'm hearing from at least a majority of the board consensus that you would like Soil and Water to do some more work on the proposal. And then Keith, when you have that, you can send that to me. We'll get it on the agenda. And then if the board gives a green light, we'll open up the 45-day comment period, and then the
Okay.
board can take action on the proposal at the end of that.
Okay,
Okay.
sounds good.
Thanks. Keith.
Thank you, Keith.
Thank you very much, Keith.
Appreciate
Thanks for
Thank you, board.
Bye.
Appreciate it. Okay, we are coming up on noon, so I'm gonna go ahead and take a 5-minute break for everybody, and we will be back just past noon. Okay, we are coming back from break. It is 12:05 for our December 8th, 2022 formal and informal session. And we are picking up at the point of
I-5, perhaps?
I-5, which is consideration to authorize Cynthia Thompson to submit the STIF-D application to the Oregon Department of Transportation, or ODOT, for 2 replacement category A buses in the amount of $1,440,000.
And Cynthia is here.
And Cynthia is
joined
here.
us this morning in case there were any questions about the request.
I have a quick question,
Okay.
Cynthia, Chair.
Sure.
This is a question that is spurred by a conversation I had with our Commissioner-elect Johnston
Uh-oh.
that you've been chatting with. And this man knows diesel and posed the question at some point, not related to this, but how quickly we turn over our buses and that type of thing. So I was asking Ken, hey, is this a federal requirement that we go to 500,000 miles or 12 years or whatever? And I was just listening to Commissioner-elect Johnston at some point months ago expounding on the virtues of diesel and how long it lasts and how maybe I'm misquoting you, but just kind of asking a question about that. And I don't know if did I do that right?
Yes, but when it came up, just for explanation purposes, it was based on 100,000 miles, and my comment was, wow. I mean, at that point, diesel engine just was broken, and I have farms in mine that have 500,000 miles.
Okay, so it was 100,000. Okay, sorry. So I misquoted. So
It's in the realm, though. You're exactly right. It's, wear and tear.
So do we have to get rid of them after
It's a good question, and I'm actually surprised nobody's asked that question over the years. There are, how Oregon does it, and this I think is unique to Oregon. There are federal standards, direct to answer your question. But Oregon categorizes vehicles into 5 categories, A through E, maybe it's 6, anyway. And so each category has a different useful life. And so the category A is the most heavy duty vehicle, and its useful life according to federal standards is 12 years and 500,000 miles. Now, most transit systems until recently, in Oregon anyway, we didn't have as much money. And so typically you would run those vehicles a long time,
Right, we were buying them
Yes.
used from people. who run
yeah,
them a long time,
sometimes
right?
years longer because you didn't really have the grant funding. You would be trying to get grants, possibly not be able to. So yes, diesel engines can run a very long time. And most of the new diesel engines are clean burning diesel, and they do go for quite a long time. I mean, I had buses when I was in previous locations that were millions of miles. I mean, we would have to do upkeep and things like that, but diesel engines can go a long time. But I will say the state of Oregon, like when I put in this application, they contacted me and the 2 buses we're getting rid of that we will be replacing, one is a 2001 and the other one's a 2004 that we purchased from other agencies back when I first got here in the fleet, was really in need of new buses, desperate. We were desperate at that point. So these buses are old. They have lots of miles, although one of them, the 2001, it only shows a 90,000 mile because the odometer had broken. So they asked a lot of questions like, well, it doesn't, and I'm like, it's a 2001. I'm quite sure the odometer is
Here's the
broken,
maintenance
anyway, so
schedule. Yeah.
on and on. So they're pretty strict, I guess I would say. They never want you to get rid of the vehicle before its useful life. And they pretty much won't allow it. If you have to prove if like sometimes you just have a vehicle that could be somewhat of a lemon, and let's say it might meet the years and not the miles. And it is an years or miles, not years and miles. So it's either 12 years or 500,000 miles. But that's a long answer, but basically, yes, they're standards, and typically transit agencies run them longer than actual useful but now we have money because of House Bill 2017, and so there's funding like this. This is a discretionary pot of funding, and Now, I wanted to note, there's a supply chain issue right now. And so they are recommending that we put in cost estimates like 60% higher than normal. So I don't actually think it's going to be quite this much money. So I made it clear, if you actually read the application, which is a bit boring, but if you did, you'd see I made a note in there that a minimum amount, because they have more requests than they have funds. And we would accept one bus instead of two. And I do think it probably would come in a little lower than this, but you'll see all of that if we get approved and recommended, then obviously it will come back to you as a grant agreement. And the whole process typically takes for buses, for this style of bus, from the time you put in an application till you actually get a bus, it's typically 3 years, sometimes 4. And that's why you kind of just have to stay on this. You have to keep applying, because it isn't like you're going to get this tomorrow.
Okay, that explains a lot. Thank you.
Great, thank you.
Yeah, thank you.
Any further questions for Cynthia? No? Okay,
No, sure.
do I have a motion to approve?
Chair, I would move to approve item I5.
Okay, Commissioner Kula moves approval. Is there further discussion? Okay, all those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. And thank you, Cynthia.
Thank you, Cynthia.
Mhm.
Item. is it I, we just said I for this. I6, consideration to authorize the Public Works Director to enter into professional service contract negotiations with David Evans and Associates. And this is regarding the engineering, design, and construction maintenance of the Pike Road Bridge. And we only received one bid, is my understanding.
And we have
Okay.
Greg Hafner, engineering project
He's
manager. on-
available if
yeah.
there's specific questions that we
Okay.
can't answer.
Okay,
But this is also, I'll just say, it's basically a notice of intent to award. And so
Right.
then this will allow Greg and Mark and to negotiate the actual contract, which will come back before the board as well.
okay. And we do need a motion to authorize, correct?
Mhm.
Yes, we do.
Yeah.
Okay, I
Okay.
will move to authorize the Public Works Director to enter into a professional service contract with David Evans and Associates regarding the Pike Road Bridge. Any further questions, comments, concerns?
I think this is this is a standard thing, but I also want you all to know that there are multiple bridges on Pike Road that have either come to the attention through David Evans through their bridge inspections or from ODOT, and there's been very quick response both from Public Works staff and from our partners, including ODOT responding back with like, well, okay, how about this? And that will include having the first bridge as you leave the city of Yamhill going out into the farmland repaired this next year. So there's a lot of movement on that road, and there hasn't been in the past. So a lot of movement with fixing bridges. Sorry.
Great. Oh, great. Okay, thank you.
Okay, do I have, no, I made the motion.
Yeah, you made the motion. I just, that was my further discussion.
Okay, all those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes. And thank you, Greg. Okay, let's see. Item I7, consideration of approval of an agreement between Yamhill County and Yamhill County Care Organization Incorporated for the Promoting Healthy Childhood Environment Project in the amount of $70,000 retroactive to September 1st, 2022 through August 31st of 2023. And Ken, do you want to kind
And
of
this
kick
is
us off
me.
here?
Yeah.
Okay.
Okay, so this is part, and let me first set the stage of how we got here. So this is part of some pretty lengthy discussions that we've had as going back into 2020, when we first originally got ARPA funds, and there was discussions around the childcare funds and how to roll that out. Fast forward, is based on those discussions. We reached out to the CCO, the Early Learning Hub. We've been having a lot of back and forth on proposals. when this originally took shape, it looked like it was going to be a pretty simple kind of grant program and we were going to roll that out. But then based on the work sessions that we had, I had to backtrack a little bit. In July, we had a work session on this and the board gave some direction as far as outcomes and discussions and things you'd like to see from the CCO. During that work session, I had a different proposal in hand. And I know Commissioner Starrett, you asked a question because at that point, there was a question around the dollar amount of what we were paying for CCO. Based on that current proposal, that was the information that I gave, that at that point, we were looking at a $10,000 investment to roll out a grant program. And then after those discussions that we had in the direction, when I reached back out, the CCO gave us a revised amount because it ended up being a revised scope of work and what had been launched. So I just first want to clarify that on the dollar amount. And I was trying to backtrack. The other part that came up is we realized that we never circled back and got this agreement in place. And there was a question where the CCO wanted to come per the timeline to give an update to the board, is when I realized, hey, wait a minute, we don't have an agreement in place. And so this was never finalized. And so that's why this looks odd. Here we are in December, bringing an agreement forward. And I think there were some mistakes made or some communications that didn't happen, that we didn't necessarily close the loop on this agreement as far as what the CCO is working on and the amounts that were proposed and where they're at in the project. And so I just wanted to, because I know at least one Commissioner, Mary, had some questions about this. And so I dug a little bit deeper yesterday afternoon to trying to figure out where we were at, because you were right. You asked, well, I thought this was 10,000. And
Yeah,
when I
that's
looked at
what I
it,
thought
and
too.
that's what I had shared
Yeah.
on July 7th. And then I wasn't in the loop or didn't see that there was a revised amount and this agreement was in limbo. And I hadn't realized that it hadn't come back before the board for final consideration and approval, but there was a revised amount based on the scope of work. That out of those discussions that I've had with the board on what we were wanting to see as potential outcomes, because childcare is such a large topic, and how best to, we're basically asking this task force to come up with a plan, much in the same way we're going to be working with a consultant on the broadband plan on coming back with a list of recommendations that the board could then look at and on how best to utilize those funds. And it's a large amount that we have set aside for childcare. It's just over 2.2 million. So
I know, I thought about this and I was like, wow, this is a lot. And then I realized that when we release funds as proposal to DCI, I'm realizing now that we didn't have a plan and we had a project in front of us that we thought was ready to go, and we didn't have necessarily a plan for it, and it took a really long time. And so I understand now that the value of being like, okay, so that's one strategy is these employer based. What are other strategies? How can we help individual care providers?
So when this was in the packet, I made the same assumption that it was the ARPA childcare bucket of money.
Yes.
So I went back and looked at the notes too, because I couldn't remember. I had the same $10,000 in my mind. And we originally discussed this on February 3rd and then decided to pull it off for something. It didn't say in the minutes. I can't remember, but
I think they weren't ready.
that was the request
Yeah.
from the CCO.
Yeah, that's right. That's
Yes.
what it was.
So my understanding is that, and so the 70,000 is new, it's a new number. It's 7 times what we thought, or at least verbally kind of agreed to. But my understanding is that they have been doing some work over the summer. I checked in with Abishan. She said that they have been having these meetings.
Mhm.
They're Thursdays. She was asked to participate on them, but she couldn't because it's a Thursday. So, but I think DCI, Tim is on the, whatever the task force is
Yeah,
that they set
I
up,
believe so.
right? So,
Because he's
And
learned a
that's-
lot.
And that's Project Oasis.
Yes, right.
Mhm.
That's Project Oasis. Thank you. I couldn't remember the name.
so I guess my question is, have they been operating over the course of this year under the assumption that we would agree to pay this $70,000?
Well, they've been operating on this specific since at least September. You know, because if you look at the timeline that's in the agreement, you know, they initiated work specific to the scope of work that's included in there in August and September.
Okay. So I guess I'm unclear what's costing seven times as much.
I mean, my understanding, not being involved in the conversation at the CCO, but based upon the proposal that was before us, and then the statement of work that's in the or that was before us versus the statement of work that's in the packet, is like you compared it to the broadband, is that this consultant there, the CCO is asking them to essentially put together a plan for increasing the availability of childcare, affordability and availability across the county, rather than simply having YCCO administer a grant program to childcare providers. Does that make sense? So almost that was my understanding from the previous and to this, the changes.
No, my understanding was that we wanted a needs assessment done by the CCO so that we could better understand where the 2.2 million should go in our county. And that's what we've been talking about. And that's what we've been waiting for. I've been talking to Abisha about it through DCI. We're waiting for a needs assessment and they were supposed to come before the board in December. So I don't know. It sounds different to me than what we had expected.
I spoke to Jen Richter at an event we were at, and she said, yeah, I think we'll do something in December. And then I reached out to Ken, who said that we were basically going to try to get an update at the end of December. Was it the end of December?
Mhm.
Okay, so a couple of things that I'm seeing here. First of all, it says in their I don't know what we're calling this, it's a proposal where they're talking about a regional assessment. And I don't know that that's something that we were asking for, but a couple of things. I took the verbiage off the CCO. We had an update from the Early Learning Hub, and they says that the hub will be submitting by December 1st, an early childhood service analysis, which takes a look at local early and education data to evaluate how well the community's providers are meeting the needs of our priority populations. These families are Latinx, Spanish speaking, geographically isolated, engaged with child protective services, experiencing mental health challenges or homelessness, and which have a child with developmental disabilities. Then it goes on, and this is not something I ever remember seeing the specifics of that. We were asking them, hey, how do we get childcare to, everybody, working parents, everybody? How do we increase the capacity there? But this one talks about basically subbing this out to something called Brave Ideas Consulting and coming up with monthly committee meetings and focus groups and parent groups. And this just sort of gives me a flashback to something we did, which we learned an awful lot when we were trying to put together the Family Wellbeing Council, and we paid $30,000 to consultants to come up with information we already knew, and we were never further ahead than when we started. So I'm looking at it, it's going to take 6 months to come up with all these different focus groups, provider groups, business groups, analyze the group conversations, and it involves a scope of work or a description of something the board never saw. I never saw this before, and the $70,000, I don't know where that came from. So I'm just wondering where all this came from, because I've never even been aware of it.
And Commissioner Starrett, to your point too, I'm looking back through my my emails as well, and I have a February 3rd of 2022 draft agenda, proposed agenda from Carolina. Sorry, that's just who sent it to me. That includes, and then the previous one is the consideration of agreement between Yamhill County and Yamhill Community Care Organization for the Promoting Healthy Childhood Childhood Environments Grant in the amount of $2,265,000. And so that's, at least in my records, that's the previous iteration.
Yeah,
I'm trying to
February
think of where then I saw
That was one of them, and I
Seven.
believe there was another work session in
7-7,
April.
is that what you said?
At some point, I'd have
Okay.
to, there was another work session in April, because there was a proposal that came forward, because at that point, the CCO was, and you may remember, they had concerns around the administration of the grants. The original concept is the turnover all the funds to the CCO,
Yeah.
and then they would administer a grant program. The county wouldn't administer any of that. And then in July, we had another discussion, and then that's where there was a shift that instead of not only was the CCO didn't necessarily want to be directly involved, but they were talking about bringing in the Mid-Willamette Valley Community Action Group, or Community Action Agency out of Marion County. They do Marion and Polk County. We're going to come and administer it. But then in July, we had another further discussion around the elements of this program, again, with still based on the original scope of work that we were talking about. And then that's when the board made it clear that you still wanted to have on any grant program that gets rolled out, that the county needed to administer that, because the board wanted to review any awards, grant awards, and have the final approval on that.
Right.
And so that's where it continually evolved, but the scope of work, the convening of the sector partners, 6-month task force to identify opportunities for expansion and address barriers collectively, communicate opportunities and updates to non-child care stakeholders, assist with research, identify during the task force process, conduct data analysis of population served, and following expansion efforts, so all that was on the table in the original proposal, but it did expand and based on the direction. And at some point there was a revised amount that the CCO said that they needed in order to administer the task force group, and that information didn't come back, like I said before.
Right.
And that's why we're here now.
Thank you, Ken. That is helpful to remember steps in the process, both internal and external deliberations. It seems, at least from me, I find that it would be beneficial to hear from either Seamus or from Jen Richter, since she's probably the lead point person on this. It sounds like you at least would be open. Can we continue it to next week, and with ideally one of them is available?
Yeah, I would
That'd be
agree.
Because
great.
it might also be an opportunity for us as a board to be like, well, is this the direction that we want to go with it?
Right. And when I spoke to Jen, she's really the sort of the point person
Yeah.
on this. And she said, oh yeah, we've got something. We just need to arrange it with your
Okay.
administrator. And so I think she's totally open to coming and fleshing out some of these details, but I do have some questions.
And I just know that, with how much the installation of fire sprinklers is for home child care providers, that's like 4 to 6 homes that could get upgraded.
Right. And then the SDC.
Just thinking about like realistically what that money could do.
Yeah, when you think of how it's limited, SDCs have limited Project Oasis, McMinnville, people who wanted to expand. And then also, I guess the background checks and stuff are taking longer in the state. So
Yeah.
folks can't, get their certifications and get through and then go to
Yeah.
work.
And that's what I wanted to highlight too, is because, when it comes to addressing childcare, it kind of it's like the same challenges that we had for addressing rural broadband. What does that mean?
What is that?
that can mean a lot of different things and there's barriers throughout that now, because I was also prepared because there were two things. One, I don't have much more information other than an email from Seamus that revised the amount. And the second part where the ball was dropped is this agreement somehow it never came back. We never closed the loop on that. And it was actually the correspondence with Jen at the time on trying to get the agenda and give an update per the scope. And I'm like, well, wait a minute, what scope of work? We haven't, that loop's still open on the contract, and that's why we're here today.
Okay, makes sense.
Well, sorry about that on your part, just having to figure that out.
No, there's just,
But it would be
there's
great
a
to hear
lot
from them.
happening.
So, yeah, and hopefully that will really help close the loop or provide direction, right?
So we haven't expended any money to the CCO for this yet. We haven't
been invoiced. I don't know what work they may have performed under the impression that it was going to get reimbursed, but we haven't been invoiced.
Right, there's a
for this.
timeline that's definitely well through it, but
Yeah.
we don't.
And
have
in
it.
light of all of this, so I'm finding I haven't had, because a lot of this, I was doing research last night. And trying to backtrack and figure out a lot of these things. I thought we were just had the formality of getting the agreement in place. I thought that was missed. And then as it goes, you start to look into it and then you realize, oh, wait a minute, there's another discrepancy here as well, or another question, not necessarily discrepancy, but another question that needed further vetting and discussion as well.
Okay, makes sense. Thank you for doing that.
And
Yeah,
so,
I mean,
that's
I
the
can
next
find
step.
it in the minutes. But I'm thinking we had some discussion about a needs analysis because
Mhm.
that was Abishai's understanding too, and we're just kind of, waiting for it December.
It was hard because on July 7th, when this was discussed, we also had a lengthy discussion about the workforce partnership, the
Oh, yeah, and
Fed
you
Core
said it, This
grant,
one's not ready.
the CTEC Sheridan project,
Mhm.
and this was also in the mix, but we didn't have a final agreement to come back before the board.
Yeah.
Yeah.
Okay.
So,
Okay, thank you.
Okay. So we will invite them on next week.
which I will say next week is raising concerns as far as the agenda is looking.
Yeah.
There's a lot of things that are on the agenda for the 15th. So I'll take a look at that, and there may be a possibility we may,
Maybe the 22nd.
22nd, maybe.
Okay.
Which I'll be out, but Justin will be here and I can make sure he's fully informed.
Okay. So we will postpone.
But I'll still target.
Okay.
That'd be great. It's something that's so lingering that it would be really good to get it.
Okay. So we'll move item I7 to either next week or the 22nd. But that brings us to item I8, consideration of approval of lease agreement number 20000001299 as amended between Yamhill County and Huntington Technology Finance, Inc. for the lease of mobile data terminals, MDTs, for the Yamhill County Sheriff's Office. Initial term of 5 years with annual payments of $59,066. And I believe we do have the sheriff on today if there's any questions. This was added yesterday, yesterday, I think.
Yeah, it was added earlier this week.
Any questions for the sheriff on these?
No, thank you, Chair.
Okay.
I will say that this is a shift in what we've done historically, where we've purchased and
Purchase.
built a capital replacement fund
Mhm.
and went through the process through IT to replace MDTs. Going to a lease model.
Yeah.
And the sheriff can provide probably a little more details on that. On what this is going to look like.
Sheriff, if you're on and can hear us, do you want to comment on the?
We'll promote him to a panelist.
snowing.
He's sporting his Seahawks gear.
You're
Oh, you're
muted.
muted.
You're muted.
It's beautiful, but you're muted.
How about now?
There you go.
No, I was
Now we
gonna
can
say
hear
the Seahawks attire is louder than you are.
Yeah. No, we're over here in Bend just finishing up our last conference day. And we've got actually one employee receiving an award tonight at the banquet. So that should be a good time. But yeah, so as far as the MDTs are concerned, it's been a conversation that we've had with Shane for a couple years now. And the concept with this is similar to like a cell phone plan where as opposed to us purchasing the equipment and then having to replace it as it breaks or putting a reserve together to buy them every 5 years. If we lease it through this company, it's a little bit more money than what we would pay for it if we were to buy it, but they take care of all of the equipment needs. If it's broke, we send it to them, they fix it. They do all the installs. And Shane has been very supportive of this concept. He likes it and it makes it a little easier when it comes to his staff time. And he said if he didn't support it, he would have advocated for us to keep it as status quo, but he is supportive of this concept.
Sheriff, sounds like you have sleigh bells in the background.
Yeah.
Yeah, no, I wish it is cold over here, but it's good meeting and good training.
Great. Thank you.
Thank you.
Okay. So I will move approval of item I-8. Is there further questions, concerns, discussion?
No, Chair.
No? Okay. All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes. All right, item I-9, consideration of approval in the matter of resolution 22-12-08-1, opposing Oregon ballot measure 114 and upholding the Second Amendment rights of Yamhill County residents. And commissioners, this is something I added yesterday. It is a resolution similar to ones we have done in the past. The circumstance around measure 114 is very fluid. At this point, it appears that the state Supreme Court has refused to get involved, which means that it will now work its way through the courts and it's effectively on hold in terms of its implementation. How long that lasts, I'm not sure. Like I said, it's quite fluid at this point, but
And I was just thinking, and I'm sorry, I was just thinking that I remember one of the comments that Sheriff made last week was that OSP will get to December 8th and then stop processing. And I'm just really hoping that that isn't the case, that they're going to continue to process since we're still in pre-114 land. But
I'm not
You
sure. I
know-
haven't heard that. Maybe Sheriff can speak to that if
Yeah.
that's been a topic
I
at your
was hoping that they
conference.
could address
But
it.
today is the 8th, so do we know if OSP is still working through?
As far as I know, they're still processing them. I know there was a lot of discussion on what the Attorney General's request was going to turn up. But as of right now, they're supposed to still be processing, running through those checks until there's been a decision on the restraining order.
Sorry, that felt like a very important thing to hear.
30,000 people backlog, so hopefully they can step it up.
Right. And so, obviously we have made our positions clear in the past about the Second Amendment. One thing about that the AG said or stood out to me in her request to the courts was that this was a life and death matter and that they need to step in and make sure it went into effect right away. I do agree with her that it is a life and death matter. We don't agree for the same reasons, but some of the reasons that I think that way are laid out in the resolution itself. But essentially, it's a reaffirmation that we swore an oath to uphold the Constitution, not only the United States Constitution, but the Constitution of the state of Oregon. And in both, they protect the Second Amendment rights of lawfully abiding citizens, and that we are restating that commitment. And also making a very clear statement in terms of how the county is going to look at this, especially with other elected officials that may have the discretion to make certain decisions that affect the Second Amendment. This is a clear statement that we unequivocally stand in defense of the Second Amendment. And so that's why I wanted to bring it forward. I think the time is now to make it known that we not only will make this statement, but we'll also explore other ways that we can push back against the implementation of Measure 114.
Thank you, Chair, for bringing this forward. I think a lot of people have been very concerned about Measure 114, as they have with a number of other pieces of what's gone into law ostensibly. The last paragraph here, Yamhill County expects the elected officials, including county commissioners and the county sheriff, who swear an oath to uphold the Constitution, to work to preserve individual liberties. I look at that as aspirational in terms of we can't speak for our sheriff. We can speak for the board, and we can be speaking in terms of representing the constituency and upholding, staying true to our oath. So I don't see this as at odds with what we've stated in the past. So I would be in favor of passing it.
Yes, aspirational, however you want to phrase it, it's a resolution. It's not legally binding document, but it's a statement of our values. And I do think the sheriff has defended the Second Amendment. In fact, one of the first meetings I went to, he made the comment about how you don't mess with the Yamhill counties and their guns. I think he understands his role there. And I think that he understands the political pressures that exist, not only for us, but for him. So I would agree. Commissioner Kula.
Yeah, well, I like you, I have great concerns about how Measure 114, once its state law is implemented. I'm not going to be assigning the resolution, but I think it's really important to make sure that we do continue to protect individual liberties that are enshrined in both the state and the federal Constitution.
Thank you.
Thank you for that. I do want to make one edit, however, in the first whereas. I want to change the word barely to narrowly. I think it's a bit more professional. So
Hey,
I will make that change.
I was like, I'm not going to be voting for this. I feel like I shouldn't say, but yeah, I recognize that's probably.
So I will send the edited version to Carolina, but if there is no further discussion, I will move approval of item I-9, and I would like to read the resolution as it's been edited. In the Board of Commissioners of the State of Oregon for the County of Yamhill, sitting for the transaction of county business in the matter of a resolution opposing Oregon ballot measure 114 and upholding the Second Amendment rights of Yamhill County residents. This is resolution 22-12-08-1. Whereas Oregon ballot measure 114 narrowly passed a statewide vote on November 8th, 2022, with only 6 counties of the 36 Oregon counties voting in the affirmative. And whereas Yamhill County voters soundly rejected Oregon ballot measure 114 with almost 60% voting against the unconstitutional measure. And whereas Oregon ballot measure 114 violates the rights of citizens protected under the Second Amendment of the United States Constitution and the Oregon Constitution, Article 1, Section 27, by depriving citizens of their right to bear arms by being made unable to lawfully purchase a firearm or bear a magazine capable of holding more than 10 rounds of ammunition in the state of Oregon. And whereas Oregon ballot measure 114 will turn hundreds of thousands of otherwise law-abiding Oregonians into criminals for continuing to possess and use magazines capable of holding more than 10 rounds of ammunition. And whereas Oregon ballot measure 114 will restrict the sale of any new firearm by requiring a non-existent safety course as a requirement to obtain a non-existent permit to purchase. And whereas Oregon ballot measure 114 will force the creation of a quote unquote registry of permit holders, which violates the Constitution and puts at risk the safety of law-abiding Oregonians, many of whom are domestic violence victims, victims of crime, or have stalking orders in place to protect themselves and the safety of their families and children. And whereas deprivation of fundamental constitutional rights for any period constitutes irreparable harm. And whereas the Second Amendment of the United States Constitution establishes a well-regulated militia being necessary to the security of a free state, the right of the people to keep and bear arms shall not be infringed. And whereas Article 1, Section 27 of the Oregon Constitution establishes the right to bear arms, military subordinate to civil power, the people shall have the right to bear arms for the defense of themselves and the state, but the military shall be kept in strict subordination to the civil power. And whereas the duly elected county commissioners and county sheriffs swore an oath to uphold the constitutional rights of the citizens they represent, and whereas Yamhill County's residents should not have their constitutional rights violated due to an unconstitutional statewide ballot measure. Now therefore be it resolved, the Yamhill County Board of Commissioners recommends as follows. Yamhill County unequivocally stands in defense of the Second Amendment of the United States Constitution and the Oregon Constitution, Article 1, Section 27. And Yamhill County upholds the constitutional rights of individuals living in the county and protects residents from discriminatory regulations that turn law-abiding residents into criminals. And Yamhill County refuses to participate in enforcement of laws and regulations that violate the Second Amendment of the U.S. Constitution and the Oregon Constitution, Article 1, Section 27. And Yamhill County expects that elected officials, including county commissioners and the county sheriff who swear an oath to uphold the Constitution and protect individual liberty, reject unconstitutional laws, and actively work to preserve these individual liberties. So being read out loud, I will call the vote. All those in favor of passing item I-9 signify by saying aye.
Aye.
Aye. All opposed, same sign.
Aye.
Thank you. Let the record show that Commissioners Bershauer and Starrett voted in the affirmative and Commissioner Kula voted in the negative. Thank
Chair, I
you.
want to thank you for bringing this forward. I also want to echo something that somebody said to me, and that is that the voters cannot vote away the constitutional rights of the citizens of the United States. And I think that's a really key place. So fingers crossed that this thing doesn't ever see the light of day. So thank you for that.
And I'll say,
Yeah,
Commissioner
thank you.
Sarah, that just following the federal and then response and then state and then Supreme Court response has been its own legal education.
Yeah,
So I'm like,
for
wait,
sure.
which thing is still in? Oh, okay. So
And it changes like several times a day.
Yeah. it does.
It's like a
So
roller
I want to
coaster.
also thank all of the people who have been supporting the efforts to litigate these at the state and federal level, and the folks who've just been stalwart in saying, no, I'm not going to do this. So thank you all.
Thank you. Okay, so that concludes our other business. So we will go into our public hearing. Item J1 is docket number C-27-18-SDR 3418. A request for an extension of a conditional use and site design review approval to site a commercial solar facility consisting of approximately 10 acres. The applicant is Manchester Solar LLC. This was continued from November 10th of 2022. And I technically am opening at the point of staff recommendation. However, we will be making a motion.
Yeah, correct. You got a
Here.
memo from Director Friday yesterday. Asking that the board reopen the record for one more week and then take this matter back up again a week from today.
Is your microphone on?
Yeah.
He just
so.
turned it on.
Okay,
Green lights on.
I saw this motion.
so at the request of Director Friday, I will move to reopen the record on docket C-27-18/SDR 3418 until noon on Tuesday, December 13th, 2022, for the applicant only to provide written rebuttal to the November 17th, 2022 letter from Andrew Mulkey of 1000 Friends of Oregon. The hearing shall then be reopened on December 15th, 2022 at 10 o'clock a.m. in room 32 of the Yamhill County Courthouse at the point of staff recommendation. Is there further discussion?
No, Chair, a long and windy road as it were, but I look forward to us being able to actually make this decision.
Yes. Okay, all those in
Next week.
favor?
Next
Yeah, next week.
Yeah.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Great, thank you. Okay, so let's see, we will come back into formal session. And what am I forgetting?
Announcements?
And I think we're. just-
Announcements and then the executive session. Okay,
Yeah, the executive announcements.
okay. Are there any announcements?
Real quick, Chair, I just want to say the good news is that the Lafayette House through the Housing Authority Affordable Housing Corporation is about to get a certificate of occupancy because the roof is on and the siding's been done. So that should be the middle of January. So I want to thank the board. The Housing Authority is very appreciative of these properties. And also just want to let you know, I had the opportunity and the privilege of attending a adult recovery court graduation this week, and they're always very inspiring. And the individual who graduated said, I want to say that without adult recovery court, I wouldn't have made it. And that's important
Wow.
for us to remember. We need
Yeah.
to support that, I believe.
Commissioner Kula?
Yeah, as a follow-up to the extensive conversation about psilocybin, I did pull together prospective licensees and Friends of Yamhill County and planning staff to kind of go over what different parties were thinking about in terms of conditions of approval, whether there be a standard package, and then also there was kind of a brainstorm about future modifications to zoning ordinances. So that was, I thought, very positive. It got people hearing from each other and when they're not in front of a microphone.
Yeah.
Just kind of, I think it's valuable. I testified at legislative days this morning, as I mentioned to Commissioner Starrett, on the supporting Oregon Department of Fish and Wildlife with their wildlife habitat conservation management program, so that folks who are at risk of losing their tax deferral status through agroforestry can actually go into the wildlife habitat program. It's been closed, as a refresher, it's been closed because ODF and W didn't have enough staff to actually do the accountability piece, the follow-up to make sure people were doing the work.
Thank you for that.
And that has to be adopted by counties, right? By each county?
We have opted into it.
It's an opt-in, okay.
Yeah, so we did our part. Assessor recognized that it wasn't much of a load for him. And so people apply. The assessor has like here's how to do this on his website. And at this point, they ODF and W says, hey, we don't have the capacity to accept you into our program. You can do all the work. So the hope is that there's going to be a streamline. There's a legislative concept to streamline the process to do self-attestations from landowners to say like, hey, we are in fact following the rules. And then have the habitat conservation biologists, I think is what they call them, at ODF and W available to say like, here's a grant program to help with restoration, or here's a way that you can do maintenance. And right now they just don't have that ability.
Okay.
How will that impact how the assessor vets these?
Right, so once ODF and W signs off on it, they just send that note to the assessor, and that essentially ODF and W takes over responsibility for vetting.
Oh, okay. Thank you.
Yeah.
Speaking of psilocybin, did you see the Shroom House got raided in Portland?
Oh, no, I was like,
Got
oh,
rated?
this is not okay. Sorry, it was very.
Well, I
it's like
mean,
saying barely rather
at
than
least
narrowly.
they're drawing a line between, growing and service centers and retail shops. So
It's
that's
good to draw a
good.
line.
Well, the
since
line
that's
was
what we
around.
were told.
Yeah, and I thought, well, how are they doing this?
no,
Line
it's
is around the
rated.
block, but I guess they are okay with it because they're doing it. But this is Portland, so.
No, they raided it and arrested a bunch of people. So I'm just surprised by that, but
They gave their contact information to somebody. But sorry, I think that's it for me. Sure.
let's see, I have one announcement. I was a judge for the American Legion oratorical contest last week, and there was one contestant, Hannah Hurdy. I believe she's from Carlton. But these contestants compete through speeches for significant college scholarships. And so her 8 to 10 minute speech was called Speak Up. And it was all about the First Amendment and how there seems to be an erosion of acceptance of free speech on college campuses. She got into other things, but it was very good. And then her second speech is an impromptu speech where we pick the topic. And so it was the Sixth Amendment. So she did a great job on that too. But these kids need a lot of practice. We've talked about mentorship before, the importance of it, but they need a lot of practice. And so I have invited her on to the January 12th BOC meeting. And just basically said, come with a 5-minute speech about the Constitution. We're going to be kicking off a new year. It's great to remind us how important the Constitution is and that we swore an oath to that. So she will be coming on for 5 minutes on January 12th. Thank you. And very proud of her. She's very skilled. So. Okay, any further announcements? Nope. Other than we have an executive session? Okay. All right, so I will adjourn. There's nothing further. I will adjourn the December 8th, 2022 formal session. It is
What time? is it?
12:57. Thank you.
Thank you, Chair.